Hi friends, good evening, and this is your host Ankit Khandelwal joining you from Delhi, India, and we have Kimberly Calhoun joining us from North Carolina, US. Good morning, Kim, and good morning to the world, and welcome to Med Friday with Doctors. And today we have a great lineup with a lot of doctors from around the world. Mostly, all the doctors are from India, but we'll start the show with one of the senior doctors, Dr. Shiv Kumar Sareen. So I would like to welcome Dr. Sareen on our show.
Hello.
Hello, Dr. Sri.
Hello, Kim.
How are
Nice
you?
to see you.
Nice
Yes.
to see you. Yes. And so, how are things going in India?
Well, there are still an ascent. There is a surge in the number of patients for COVID. So we have despite all lockdowns, the numbers are increasing. So that's the challenge with us. Yes.
Right. No. And that's the challenge we have in the U.S. Let's discuss that just a little bit. Let's talk about what are some of the things that you're finding with the patients that you have. Are you doing, is the country have a set policy for treatments and things like that?
So I'll answer first the chances of the infections. So everyone in the world had initially learned from the Wuhan experience from China, and they all thought that the number of people, let's say there are 100 people who get infected, 80 would not require hospitalization, and 20 would require hospitalization, and of them, maybe 5 will go to the ICU and 2.3 would require a ventilator. However, what we have learned in the last few months in Delhi at least, that of the number of people who get infected, the number who require ICU is not 20% or so, it's much less, 5%, it is something close to about 1.6% instead of 5%. And the number who require to be on ventilator is still not 2.3%, but just close to about 0.3 to 0.4%. So the disease is probably less sick. These patients are less sick and disease is not as severe, and the number of mortalities are also much less compared to maybe China or maybe even the US. US has a very high number. So the crude mortality is just about zero point 0.3 per 100,000, so which is much lower. So why is it that people are less severely infected or less need of ventilation is a huge positive thing, and there are probably 3-4 reasons for this. One reason can be that the cases are picked up early, people are wise enough. Everyone who is having even mild symptoms, or moderate or symptoms where oxygen requirements are between 94 or 96 are very well monitored. And they all are being given now an oxygen sensor. The people are quite aware of it. Secondly, the patients who are sicker, where oxygen has dropped to less than 90%, are being moved into hospitals very rapidly. In fact, anything which is less than 94% is also getting into the hospital. Although WHO says don't do it, but we are very clear, it's not the number who are infected, it is the number whom we lose, it is the deaths which we are more concerned. So the whole country, especially Delhi where I live, the policies are oriented to decreasing the mortality as much as possible. The second cause why they are less probably could be because many of our people have been using masks very carefully, and the BCG vaccination changes your immunity. If you get a BCG in early childhood or young age, you have a trained immunity. So your immunity is trained to receive any insult. So that could also help. These are some of the thoughts that I have.
Those are very good thoughts to consider, as well as could have. And I never thought about training our system, right? That a vaccine could have trained our system. So these are very, very good. What I call, let's talk about it. What's having success? You've brought up some really good, strong numbers. But I'm curious, when you are looking at these as an overall. Because in the beginning we heard, that it was affecting elderly only. Now we know it kind of affects others. Is there an age limit, or have you seen a significant difference in whether you're younger or older?
Let me take you back 100 years. 100
Okay.
years.
100 years.
1918, when the Spanish flu had occurred, 1918. Imagine 100 years ago. Even at that time, the number who died, almost 90% of them were above the age of 65.
Okay.
Although most of the people who were infected were well distributed from young to the old. And the same trend is even today. If you have a person who gets COVID-19 disease, I hope you know the difference between the disease and the infection. Disease is complete. You have lungs, you have organs involved, while infection is SARS-CoV-2. So when somebody gets SARS-CoV-2 and gets the disease, of the people who get the disease between 20 to 40 years, mortality is just 0.2 to 0.4% anywhere in the world. Why India is having lower number of deaths? Because the average age in India is 28, 29 years, like Turkey. So we have a youngish population. That's another reason why the deaths are less. But when you go to somebody like above 80, 14% will die. So
Well, that's
the same number of infected people, but if an elderly is infected above 70 or 80, he has comorbidities of diabetes, blood pressure, heart disease, kidney disease, obesity, blah, blah, blah. And they die.
So, that's something to consider too. And we've been talking about this for quite some time, is, just having a healthier immunity system, period, right? Which can't hurt, right? Build our immunities, get healthier, eat healthier, be healthier. It's not probably going to prevent you from getting the disease or the virus, but it's certainly going to help with being able to struggle through it. And I am curious, the people who have had the virus, what has been the biggest complaint of symptoms? And have there been, are there after recovery symptoms?
Well, I don't treat COVID patients. I just advise the government. But from what we advise and what we see, a large number today are without symptoms or very mild symptoms. They were just picked up because somebody else got infected. But when you look at those with no symptoms and get their x-rays or get their chest CTs, they have mild features of pneumonia. So the disease is there, the infection is there, but symptoms may not be. So absence of symptoms does not mean the absence of disease. Number two, that people generally are having, like one of our very senior professors whom we lost, very, very respected. He presented with diarrhea. So some people, not large number, are presenting with abnormal symptoms like abdominal discomfort or diarrhea. But to put it on the record, majority of people have mild breathing difficulty or moderate breathing difficulty. They have cough, they have running nose, or they have sore throat. But this is common everywhere. And you know why sore throat occurs in these patients? This virus, unlike the SARS, multiplies here. It's in the upper part, not in the lower respiratory system, and multiplies very fast and causes injury there. So that's why it spreads also very fast. So because most people are like that.
It can project from your throat and out. So that's interesting that it would collect in this vicinity. So your specialty though is the liver, which is something that my mother died of a very rare liver disease, hepatic duct cancer, and that has always had an interest to me, the functions of the liver and how things happen. The liver is quite the interesting part of the body, isn't it?
Yes.
That's where everything
See,
kind of filters.
yes, it is your main heart. It's not this. This heart is only a pump.
Right.
It has nothing else to do. Liver is the main source of energy balance. It's your
Exactly.
actual heart. They
Yeah.
call it second heart. So
The
I'll tell
second-
you how
Go ahead.
COVID involves. Before I go, let me tell you something which you will never forget. You know, about 2000 years before Christ, liver was the organ which was kept in the temple and was worshipped. There were no other gods and others. It was the liver, real liver, which was kept.
Wow.
And people used to worship it. And all your horoscopes were written on the liver. So there are pre-Babylonian times, and liver was called lifer, life.
Life, live, live, live.
Life, yes.
I like it. Life. I like it.
Yeah. And those who had were cowards were called having a lily liver.
Lily liver.
Yeah.
Liver. I love it. A
And
lily
people,
liver.
yes, and people didn't say that I give my heart to you. They would say I give my liver to you, or you give my liver to you. And if you love somebody, you say I give my liver to you. Anyway,
Wow.
even
That's wonderful.
Well, it makes sense because it does bring the balance to the body, right? Without it, we have no nutritional balance. We have no filter for any diseases that go through us. I mean, so in the liver, what exactly is happening today? If it's doing anything with the COVID, what happens?
yes. So this virus has several cells of its choice. One cell of its choice is the pneumocyte, the lung epithelial cells. But the second site it likes is the cells of the bile duct and of the intestine. So it multiplies in the intestine and it spreads, and also in the bile duct. So this is to know that where are you housing the COVID, the SARS-CoV-2 infection. So somebody is passing the virus in the stool also, it can stay in the liver. But fortunately, liver is a strong organ. So normally 10% to 40% of the healthy people, if they get SARS-CoV-2 infection, they have liver injury. The liver enzymes go up, and only about 3 to 5% have a problem. 95% of those who get liver injury recover by themselves.
Wow.
Number two, about 5% of the world's population either has hepatitis B or hepatitis C or a viral infection. And about 15% are overweight.
Obese.
The world, yeah. I mean, in US, it's as high as 30% are overweight. 1/3 of the US has an epidemic of so-called overweight or obesity. So all those who are overweight have a bad liver. So the virus can affect diabetics, the guys who have fatty liver, those who have obesity, and they have the virus. But there is another important group, those who are boozing, the guys who take alcohol, and they also have an effect on liver. So we did a very large study which is under review called EPCOLIS study. EPCOLIS is Asian Pacific COVID-induced liver injury spectrum. This is a big acronym for a big study, and this is a study where we picked up very large number of patients from 13 countries in Asia who had liver disease. And when they had COVID-19 disease, their liver injury escalated. So if somebody has an existing disease, the chances that he will get jaundice, the chances that he will get fluid in the abdomen are 1 in 5. 1 in 5. So somebody with pre-existing liver disease, which is not known otherwise, is known only when you have tested an obese or a diabetic person. By the way, diabetics have 3 times more liver affliction compared to a normal person. So a diabetic, 10 to 12% of the population is diabetic. 1/3 is overweight or obese. All these are predisposed to liver injury. So when you ask me, how does this viral infection affect the liver? So I will say, look at those who are vulnerable.
Yeah.
We are only counting vulnerable or comorbids as those who have diabetes, hypertension, heart disease. But those diabetics have liver disease are worse. Those obese who have a fatty liver are worse. Those who are drinking alcohol are worse. So these also should be considered, and these patients must be given priority in admission, priority in monitoring, priority in their treatment regimens all over. So this is what we strongly feel that we have, and this is under recognized.
So, how can we improve our livers? Is there, like you said, it's our heartbeat, but how can we improve it? Some of us may have damaged our livers through drinking over the years, or just, natural, maybe just naturally things happen because as we age, things age. How can we improve our livers?
Liver doesn't age. First
Liver doesn't age. Woohoo! I'm loving that. No wonder they worship the liver.
There are 2 or 3 things we do not eat. Your nails, you keep growing them even at an elderly age. You cut your nails, they come back. You cut your liver, it regenerates. You cut it to half, in 30 days, your whole liver comes back as a new liver. So liver regenerates fast. I don't know if you know the story of Prometheus. Prometheus was the god who brought fire to mankind. He was the one who brought fire to mankind. Nobody knew fire. So when the other people saw that, oh, fire has been brought, now people can see, they can heat up things, they can cook. The other gods wanted to punish. So he was punished that he would have a vulture. The vulture would eat the liver in the day and then leave in the night. And in the night, liver will come back to its original size. So liver regenerates in night. So the basic message is don't eat at night.
Oh.
If you want to keep your liver healthy, then there should be very limited fat in your food, be natural. 2, be a Jew or a Muslim or a Jaini, Hindu, who do not eat after sunset. And the 2017 Nobel Prize in Medicine went to a guy who gave the concept of clock genes, how your diurnal, how your sleep, how your rhythm of life is maintained. And it's very clear, the same food if you eat in the day and the same food you eat at night, you gain more weight when you eat in night because of that. So to keep liver healthy in simple terms, try to stop eating late, number 1. Number 2, keep your weight in control. And I'll give you a simple formula and I want you to practice. I want you to tell others. The simple formula is height in centimeters minus 100. If you are 160 centimeters, then your weight should be 60 kg for a man. And for a woman, make 10% less. Now, if you have that weight, your liver will not have fat. So to keep liver healthy, 3 things are...
I never heard that formula.
Yes. The formula is height minus 100.
Somebody is put that formula up on
no formula. 170 centimeters minus 100, your weight should be 70 kg. And for a female, make it 10% less. But there is a caveat. If your parents, mother, father, had diabetes, blood pressure, heart disease, you are a defective piece. You have to
Nice.
reduce further 5% to make sure that you do not get those diseases. So, how to keep liver healthy? One is your weight. If your weight is good, ideal, your liver will have no fat, you are out of it. Number two, of course, don't eat when people should be doing other things. Three, you have to avoid insulting the liver. And the insults are, of course, alcohol is one, but there are many other insults, and some of them, are high fat foods and many, many things. Everyone knows, but they just can't avoid it. So these are three things. Don't insult. And liver is an organ which can always get back to life and bring you back to life. It doesn't die, it doesn't age. It's the one which has the largest regeneration potential. Even after COVID injury, it recovers like this, fast enough.
So, and I think that's beautiful. But how does cancer affect liver? It's got my curiosity at this point.
You have very rightly asked at the very correct time. Liver regenerates. But have you ever seen it going like this? It stops at some time. You cut the liver, it's a 1500 gram organ. You remove 700 grams, it will bring back 700. It will not become from 1500 to 2000. So somewhere it has to stop. If it doesn't stop, then it will keep growing. So what is the problem in a cancer, especially in liver? It doesn't stop and it keeps growing. And when it is like somebody stops drinking alcohol, the liver should start regenerating. But when it regenerates, whether it takes the path of cancer, excessive growth, or it takes the healthy path of just bringing back the normal liver. You get my point? So the pathways of regeneration, if misdirected, they become cancerous. If the pathways of regeneration are properly directed, liver gets back to health. Now, in which situation your pathways are deranged? The abnormal pathways will come when people are overweight. Obesity is the number one cause today of getting liver cancer more and more. Liver cancer is the second common cause of cancer deaths today in the world. Second common. And by 2030, just 10 years, liver cancer will become the number one cause of cancer deaths world over. So, if you want to know how cancers occur in liver, there are 3 or 4 common. One is obesity, second is alcohol, third are viruses, and of course, some are genetic, like you inherit. And if you keep your liver fat free, no alcohol insult, you're vaccinated for hepatitis B, well, you can be very well, you can prevent liver cancers. Another important thing is somebody in your family, like your family, mother had liver cancer, you have to get complete testing done. And your children should be underweight. And this is not for you because you are here, for everyone who is hearing, listening to this very important program.
No, this is such enlightening news. This was just so odd because even my doctors were, the doctors were curious because my mother never traveled much, but she was not overweight. She would never drank after the age of 20. She never had alcohol or didn't smoke. Very somewhat healthy lifestyle, but not wealthy, so she didn't probably eat as healthy as she should have all the time because the cheaper foods, the most cost-effective foods are not your healthiest. But she was never obese, so I thought that was odd, like what you're talking about. The doctors is very weird too. But I'm glad I had this conversation because it has always made me worry, and I do try to get tested, but I'll get tested more. But it was always very curious to me about why the cancer took over her liver. When, like you were saying, livers generally heal themselves. I had no idea they could heal themselves in bad. I didn't understand that. So that's Okay, is
Well,
there a way?
if you don't know, then I can imagine how few people would be knowing it. You
Right,
are
well,
in this, so I wish you can spread this message far
I
and
will.
wide. And to answer that your mother was not overweight, the cancers occur more in lean people with fatty liver.
Wow. Okay.
Another day we will talk at length because this is very, 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 very important, and very few people know why people, even those who are lean and thin and have no other reason, get liver cancer. So another day.
No, that's beautiful. And I stole a question from Ankit. So Ankit, go ahead.
Okay.
Go ahead,
So,
Ankit.
Dr. I have a couple of quick questions. So, first of all, a person who is suffering from serious COVID infection and they come out after a marathon 2 months of ventilator and things like that, and now he's negative. So, does he still think that he could, have some kind of problem in his liver in future, or is he COVID free now and there is no any problem in his lifetime?
Yeah, that I can't say because second wave can always come. But if he has a pre-existing liver disease, he remains a high risk person all the time.
Okay.
Because as I said, the virus multiplies in the bile duct which is in the liver, and the virus can stay for long. But in a person who has a healthy liver and has recovered, I don't think there is any fear of liver disease.
And sir, if a person is, COVID free and they're COVID, they have positive or maybe negative treatments happen after a couple of months. So, is there any lifetime problem in terms of any of these organs will hamper a COVID somewhere, we can think that he's fit and he's healthy to live a good healthy life.
So the world has known this virus only for 5 months. We don't
Yes.
have much knowledge, and I would be, rather guessing that it is good or bad. But as of now, the only organ where the damage can continue is kidney. Even the lungs have been shown to recover, but
Okay.
lung and kidney are two organs. Heart disease is known to recover, but we don't know whether the brain. Uh, so I think we'll know it after some time, not now.
Okay. And sir, lastly, how we can protect or keep our liver healthy?
Keep smiling, keep remaining healthy, and as I
Okay.
said, three simple tips. Don't insult it. That means keep your weight,
Yeah.
keep your liver fat free, avoid any vaccine or this thing alcohol, and get a vaccine for your liver. Okay.
And then that's something I need to talk to you about even after the show, how to get a vaccine for the liver. So, no, it's just, and you've opened my eyes to something I've always questioned. And I've even asked my own doctors because I get very, very nervous about the liver when what happened with my mother. Because, like you said, it could be hereditary. I don't know. So, I always thought, but I'm going to follow your order. I'm going to stop eating after dark. That's very, very smart. So, and slow down on the liquor and things like that. But slow down on the fatty foods. I eat too much fatty foods. I need to slow down on that.
Yes. Be natural as much as you can. Eat natural.
I got my blueberries.
That's very, very, very good. They have carotenoids. Blueberries are very good. Anything which is colored, anything colored is very good.
My mom always
Sir,
said the more colorful the plate, the better. What?
Sir, my problem is that I work late nights, and at that time I have to eat food. What should I do? How should I manage that?
Yeah.
Well, you may look young right now, but if you want, remember, there is no other way.
Okay.
Because what you eat, and that's another discussion, is not eaten by you. It's eaten by the bacteria which live in your intestine. It's a 1.5 kilogram organ. And once they are in action, they are the ones which send signals everywhere. So please, please, for God's sake, change your lifestyle now.
Okay.
Okay.
And I think that's probably the best. I don't know that it's ever too late to change your lifestyle. I do know that these foods taste better. And I
Yes.
learned from Dr. Sagu to chew more, right? And I taste it more now. So if you chew your food more, you eat slower, you're probably healthier for your body, and you taste it, you enjoy it. Colorful foods, like you said, my mom always said, the more colorful the plate, the healthier. So, yeah,
But that was a wonderful session with Dr. Sareen,
Thank
and
you.
we had a
Thank you.
very informative and eye-opener discussions and facts which were not aware about our viewers and ourselves as well. And right now, sir, Dr. Sareen, I mean, people from across the world are watching us live, and they have so many questions lining up. But I think you have to leave,
Yes.
so maybe we can take the questions next time.
yeah,
And
next time.
it was lovely to have you, and would love
Thank
to
you.
have host you again and
Thank
again as and when we
Thank
can.
you. Thank you,
you.
Angit. Great show and a great team. Thank you.
Thank
Thank
you.
you.
I feel like I have years worth of answers now. I almost want to cry. Thank you very much.
Okay. Bye-bye.
Thank
Well,
you.
I'm so sorry I came in too late to ask them a question because this is a perfect conversation for the Irishman. The Irishman abuses his liver with alcohol.
You
Yeah.
insult it. You insult it. I love our new language. You insult your liver.
Right, right. So I was fascinated because my sister actually had a liver transplant. So my question was going to be, the liver regenerates, but there's also cirrhosis of the liver. And I don't think that part can regenerate. I think
Well, I
that's
think we missed that conversation, but he's going to come back and we're going to have more of those conversations. Dr. Sagu,
Hi.
you bring a smile to my face today.
Namaste.
Hello.
Namaste. Sat Shri Akal.
Stay.
I'm eating
Sat Shri Akal,
healthy. I'm eating healthy.
Dr. Sabu, you just joined, and then
That's good.
Dr. Sareen was there on our show, and he just left and you just joined. I wanted you to join at the same time, but he has to go somewhere, so he just left the show. And we were discussing about livers and fatty livers and how people have they were worsening liver in 2000 years ago. Oh, there was some connection.
We were talking about obesity too, so which was very, very important. What you missed in the liver conversation, because my mother died of a very rare liver disease, especially in the U.S., is commonly known in the Asian country, is hepatic duct cancer, and it spread like this. So I'm no doctor, and it blew my mind because I always thought the liver kind of regenerated itself. I didn't know this much of it, right?
Right.
But the way he explained it is that even if you cut the liver, it grows back. But when you have a sick liver, its odds can either grow back the sick part at that rate, or it could grow the bad part at that rate.
Oh.
I mean, the good part. So you don't know, right? So even like in my mother's situation, they couldn't believe it because the liver, the cancer spread like overnight. It just took over. But what happened, now that I understand it, is that when her liver rejuvenated, it grew back the bad part.
Oh, wow. That just seems like the roll of a die. It's unbelievable to think that can happen. So that was eye-opening to me as well.
So, well, and when he comes back, he could probably answer your question about that stuff. But Dr. Sagu, we just had a wonderful talk about obesity with Dr. Sinai, and so this kind of is great to have this conversation moving forward here.
Oh, that's good.
Yeah.
Dr. Sareen is a very good liver transplant physician, and me and Dr. Sareen, we are from the same college from Jaipur.
Yeah.
He was very senior to me. And right now also, and he is doing wonderful job. There is a specialist liver hospital in New Delhi, and he's taking care of the hospital and taking care of all the patients over there.
And to understand some of the concepts that he mentioned about how obesity causes majority of the liver problems, how the liver works, it was just very eye-opening, and it's a good reason why we should listen to you about how to avoid obesity or fix our obesity, because I even think it's not too late for some people to fix it, right?
So basically, Kim, what happens whenever we take, there are three basic components of the diet, that is carbohydrate, fat, and protein. So some component, that is the carbohydrate, the absorption is very fast, right? And calorie is more. And some protein part, the absorption is very slow. The calorie is the same. The fat is there where the absorption is very slow, and the calorie is more. So we call fat as a efficient energy giver, but absorption is slow because the carbohydrates absorption is very fast. So whenever we eat chocolate, right, whenever we eat simple sugars, they are going to absorb it very fast, and the sugar is going to rise in the blood level very high. So whenever we eat chocolate, it will give a surge of the blood glucose level, and that again causes release of the insulin from the pancreas, and the insulin causes decrease in the blood level, hypoglycemia. So after taking simple sugars, you can have a immediate hypoglycemia, and that hypoglycemia will again trigger the hunger receptor in your brain. So you will eat more. So whenever you eat the things which are absorbed very fast, it will give your hunger to raise up upwards, and you will eat more. So you are taking more calories, and then you are again, this becomes a vicious cycle, and you are going to take more and more calories. So when your sugar is very high, when you have taken lots and lots of calories, the excess calories has to be deposited somewhere, right? So the excess carbohydrate, they are going to deposit in the form of the glycogen, and the glycogen, the major part is the liver. So the first place where the glycogen will go and will deposit it in the body is the liver. So that is why Dr. Serene mentioned, because of the obesity, the first target organ is always the liver. So the fat is going to deposit in the liver, right? Glycogen is going to deposit in the liver, and that will give rise to fatty liver. That is stage 1. And from fatty liver, it is going to proceed to NASH, that is a non-alcoholic steatosis of the liver. And from NASH, it is going to cirrhosis. So what Dr. Serene talked about the cirrhosis, so it can be non-alcoholic or alcoholic. So without alcohol, if you are going to damage your liver, the major reason is obesity. So because of the obesity, your liver can be damaged. So I think we should always take care of the obesity if we want to save our liver. So second part, the glycogen is being deposited in the muscles. So in the muscles also, they're going to deposit. And then, we have a habit that if we have extra money, we are going to keep it in the house, some place in the almirah, some place in utensils also, some place somewhere. They usually hide their money. So same thing is there. When we have extra calories, our body is going to hide all those calories, some in form of glycogen in the liver, then in the muscles, and in small vessels also. In the heart, we have small vessels. The vessels take the blood from the heart to the organs. So these glycogens, they are being deposited in the vessels, then it gives rise to the cardiovascular problem. So our arteries are being obstructed because of that, and then we need to put a stent in those arteries. So because of obesity, a lot of things are going to happen if we are taking the extra calories. So message is, don't take extra calories. Whatever you need, have that. And whatever you have extra, burn that. So the God has given us 2 candles, one candle in form of the glucose, another candle in the form of the fat cells. If we are not going to burn these 2 candles, one of the fat, one of the glucose, these candles are going to burn us. The fat candle will give the obesity, and the glucose candle will give us the diabetes. So we need to take care of that.
Yeah, I mean, it sounds so like common sense. Why aren't we taught this in school? I mean, I think somewhere I missed a class, right? Because doctors know about this. You went to college after me, but you went to college to specialize in these things. But I feel like we're missing this in class somewhere. I mean, we learned about the food pyramid, but I feel like it was wrong the way they taught it. My mom always said the more colorful the plate, the better the food. So I always try to think that way, right? But but the way you explain it and it just makes more sense, right? Just because sometimes you need to understand the damages that you can cause by not eating right.
But Kimberly, we have a problem in America because, and at least in probably
Big problem.
with
I know.
income inequality so that the people that do not have a lot of money to spend on food buy the cheapest food. And so that's how we have all these fast food restaurants, which are packed with just the wrong foods for us. The way you explained it to me was eye-opening. And I think that if you get I don't want to step on any fast food in particular, but you get a big hamburger and it's got a lot of bad food for you, but it's filling and it's what they can afford. So the problem goes beyond just knowledge, but to poverty.
So, Jim, what happens? We are being trapped by these crocodiles in form of the corporate food industries. So we know that crocodile is coming to us, but even then we are always ready to being trapped by the crocodiles. So these are all, the food industries, they are offering us on the low cost, unhealthy food, and we are being trapped by them.
I mean,
what they're offering
these instead of fries, right? So when I pull into McDonald's, even if they offer me a burger, right, it should have been in lettuce, not in bread. But because I see people doing that now. I used to do it. I used to want to avoid too much bread. So whenever I would go through a food line, like a buffet for a picnic or something, I would get 2 pieces of lettuce.
Yeah, no,
and eat my burger. So, but it probably wasn't good. But why can't the fast foods offer this or apple slices? They go bad fast. But if you're eating like you do fries, you're gonna eat it fast, right? But at an abundance, we could definitely eat more of this and be healthier than we are if we're eating the French fries and the bread, all that bread. It's just insane to me, all that bread. My mom used bread as filler because she had a lot of mouths to feed and we grew up poor. So she used a lot of bread for filler. And but it wasn't healthy, right? So how can we, as a team, come up with a way that we could provide, and I know Ankit would love to do this because he's brought this up before. How can we devise even a fast food restaurant that provides this and the healthier foods as opposed to the ones that the media pushes? Yes, Ankit.
We need to come up with a lot of offers because right now a burger, if you buy one burger, you'll get another free. You'll buy one pizza, you'll get another free. So that way we have to come with a lot of lucrative offers for our people and force them to buy all these things. And also we have to mention about the calories, about what causing these hamburgers in your body. The way we mentioned in tobacco that is injurious to health. So something like that we have to mention on all these fast food so that people should aware and we can create more awareness because you can't stop it, but you can prevent it after or maybe sharing a lot of awareness information in terms of what it causes to your body.
Yeah.
So I think,
and I think that way we can try to do something. And on the other side, we can also. Yes, sir.
Go ahead, doctor.
Yeah, Ankit, I think tomorrow we are going to talk about the calories only. So tomorrow we'll talk about the calories, how to calculate the calories and how we should keep ourselves away from the high calories so that we can prevent the obesity. So today, So tomorrow in our show we are going to do. So now I will take leave. And before going, I would like to introduce Dr. Jinder Kaur Saggu. She is my wife. And she is the main driving force behind me. Whatever I'm doing in the present era, all because of her. So I have a big motivation. She is a breast cancer surgeon. And she was trained from Tata Cancer Hospital from Mumbai. Then she went to MD Anderson Cancer Center, Texas. And she got trained from there also. And now she is serving as a consultant, senior consultant, breast cancer surgeon in Apollo Hospital, Indraprastha Apollo Hospital, and she's taking care of the breast cancer. And she has treated a lot of females, and she has a lot of fan following also. So now I'll take your leave, and within 5 minutes, I think she's going to join me.
I just wanted to request you that if you leave out and then change the name, display name, because right now the name is SS Saggu. So if you leave and
No,
then change the name, and then ma'am can join.
She will join from her phone only. So she will use her camera.
That's fine.
So, Dr.
Okay,
Sagoo,
that's
fine. See you.
lovely of you
Thank you,
what a
Kim,
wonderful
Ankit,
intro.
Jim, and Sasha. See you tomorrow.
Bye.
And
Take
don't miss
care.
my program tomorrow. Don't miss my show tomorrow.
Oh, I'm there. Thank you.
Yes.
Bye. Lovely. What an introduction. Wow, to have your husband get up there and introduce you that way. How awesome.
And my
Yes.
wife wouldn't do it.
Sasha, I mean, that you talk about your wife the same way. So that's way cool. So I can't wait to meet her, especially in the breast cancer industry, medical part of the industry. Breast cancer is a huge problem worldwide, globally. I don't know the stats, but we'll kind of leave that to her to share with us. But I've many friends who have been through the breast cancer process. And I think the numbers are so high that we all know somebody who has. Am I correct, Jim?
You're right. Absolutely. And
Sasha, I mean, all of you, Ankit, you probably know somebody. We all do. We all know someone. And in some cases, the medical industry has stepped up, especially the doctors, because they know that if early detection can mean early treatments. Early treatments means odds are you're going to save the life. If not save the life, extend a life by 10 to 20 years in good quality life.
Right.
And the treatments have become even better. But early detection has become, to me, the most important part of this disease, any disease. Any disease. And one of the things I noticed is the insurance companies take a really slack attitude about this now. Any cancer, ovarian cancer and breast cancer. So, but I think our visitor has arrived. There she is. Oh, he's helping because he's done this. Yay, welcome. Namaste. Can she unmute?
Ma'am, you need to unmute the mic. You need to unmute the mic.
We need to get her picture up there.
Yeah.
So how does she like to be called? Dr. Sagoo or?
Ma'am, you need to unmute the mic. Okay, so there is some problem with the...
He'll get it fixed. He's done this enough. He knows.
Yes.
How does she like to be addressed? Is it Dr. Rajinder, Dr. Sagoo?
Dr. Sagoo, Dr. Rajinder Sagoo.
Rajinder Sagoo. Okay.
I prefer Grandmaster.
There you go. She's a master Sagoo. But what a lot of people don't understand is we used to have the mammograms almost for free every year. Right, every year, and ovarian cancer, we would have a Pap smear done every year. The cost of tests minimal, except that insurance gets in the way, and so the doctors have to charge more in order to recoup. And this, of course, the labs have to charge more because the insurance takes money out of every transition. So,
Kimberly, why are we focused on treatment, which is so expensive, and not on prevention? Which could be
prevention is early detection.
Right.
So early detection
why is
and then
the
treatment.
system backwards?
Right.
I don't understand.
Well, the thing is that they determine the amount of people that is caught in early detection and that die is not worth paying for the test all the time.
So it's an actuarial thing.
So they've come to the ratio, right? The amount of lives saved is not worth the amount of money we spend on testing.
I see. That makes sense to them.
But for every life that is lost over this, it doesn't make sense. And it's a simple test. It's like I said, we could be testing for COVID, say for even $200 a month. Each person could be tested every day. That's a heck of a lot better than the stimulus checks they're paying us or anything. And it wouldn't really cost that much because the more volume of tests that you buy, the cheaper it is. So but they determined that the cost of early detection wasn't worth it. So
Hello.
Interesting.
Yes, ma'am,
Namaste. Hello.
Dr.
Shashikal. Hello, everyone. Hello, Ankit.
Namaste.
Namaste. Namaste. How are you doing?
Fine. Welcome to
How are
IB
you?
News TV.
I am so happy to join you all because every day I've been listening to Dr. Saggu. This is happening, that is happening, and I'm so glad to meet you all today. Very
Oh,
nice to see you.
And we,
what a
ma'am, we are
lovely
all really excited to have you on our show. And you know that I'm trying to get you on the show. It's been a while, and finally you are there talking to us today.
Thank
And
you,
we
Ankit.
are very excited.
So
I'm glad I accepted your request. I'm glad I'm here with you today evening.
welcome to our talk show. And such a blessed family, such a beautiful family to be serving the community the way you do as
Thank you.
doctors. Thank you.
Thank you so much.
And two very important medical areas, because breast cancer and women's breast is has become such a profound problem, hasn't it?
Exactly. Breast is the important part of women's femininity. It maintains a body image, and having so many diseases with the breast, like it's such a big, shocking and distressing thing for a female to know this. I know.
So let's discuss some of it, because how long have you been as a doctor in breast cancer?
It's been more than 17 years.
You don't
Yeah.
look that old. You don't look that old. So you're so beautiful. So let's talk about 17. Why did you choose breast cancer? Because this is a lot of study, right, and a lot of research. Why did you choose breast cancer?
Actually, I became surgeon as a choice, and during my surgery internship period, my father was diagnosed with cancer, and it was a stage 4 cancer. He had a metastasis in liver, and we could not diagnose the primary. And I, being a doctor, my father was never ill. He never had even a headache. He never went to a doctor during his whole lifespan of 70 years. And one sudden evening, I got a message from home. I was in my hospital, which is almost 200 kilometers from my home. And I got a call that my father is unwell and he's hospitalized. It was really a big shock to me that my father going to a hospital was a big thing. And I went to see the doctor straight away from my workplace, and the doctor told me that your father is in stage 4 disease of cancer. And it was such a big shock to me. First of all, I couldn't believe, and I collapsed there. Being a doctor, I didn't know how to react, And we lived in a very small place in Punjab, and there was no facility available for this cancer thing. And then I shifted my father to a bigger city, but he didn't survive. He just was with us for 2 days only, and he passed away after 2 days of the diagnosis. I was unmarried at that time, and I was in my second year of the residency of my surgery. And from that day, there's a guilt in my mind that I couldn't do anything for my father. And I wanted to do something in this field. And later I got married, and my husband, Dr. Saggu, and he's a passionate laparoscopic surgeon, and he taught me laparoscopy. Actually, he taught me. He held my hand. He told me how to do the laparoscopy procedure and everything, and I went very much confident in laparoscopy. But one fine day, my Guruji, we go to a Gurdwara, we do charity there, and I have a Guru, who is my father's Guru also, my grandfather's Guru also. And he sent me one patient who was very close to him. She was diagnosed with breast cancer. She was just 30 years old, a mother of 2 children, very small, and she lived in Nairobi. And he sent this lady to me. He said, you're going to treat this lady. And I was a laparoscopic surgeon, not very well versed with the breast cancer. So I got hold of a very good breast oncosurgeon. And with the help of him, we did the breast conservation surgery on that lady. And it went off successful. She's doing fine till date. This was done 17 years back, almost 15 years back. She's doing absolutely fine now. But that was the day I completely changed what I wanted to do. I thought we both are laparoscopic surgeon, both husband wife. We both are not. It's the same profession. We will be having competition in this maybe later in life. So I chose, and my inclination was towards breast. Slowly and slowly, I developed the interest into the subject. I left everything laparoscopy. I went to Tata Memorial Hospital. My husband was very supportive. I had twin daughters. He took care of my twin daughters and sent me to Tata to do a fellowship in breast surgery from Dr. Badwe, who's the big name, renowned name in breast cancer surgeries. And I was trained under him. And then I went to MD Anderson Cancer Center for some time to do an observership in the same field. And after coming from there, I'm attached to Apollo Hospital. It's been more than 10 years now. I'm with Apollo Hospital and serving breast cancer patients. This is my story.
Wow, that's a beautiful story. Oh my
Thank you.
goodness. And to continue doing what you do, because this is continued research. This isn't just doing surgery. You continue to research to find solutions. The surgeries have probably changed over the years, right? You know, how you practice. What are some of the things? Let's talk about because you live with this every day, your patients and everything. Breast cancer, has it become a bigger problem in the past, say, 10 years, 5 years?
Exactly. This is because, obviously now World Health Organization has, according to their data, now breast cancer is the #1 cancer amongst women globally. No, and the incidence is rapidly increasing. This incidence is increasing because we have now better modalities to diagnose breast cancer. We have better modalities to treat breast cancer. We can detect it early. There are so many screening programs coming here to make women aware about the early signs and symptoms of breast cancer. That is why we are detecting also early. Numbers are also increasing. But in India, the problem is more younger women are diagnosed with breast cancer. Their breasts are dense. We cannot diagnose them in a very early in dense breast because there is overshadowing of the breast tissue with the lump in the breast. And another thing is that women present late because of ignorance, maybe because of fear, maybe they don't want to go to a doctor. And in younger women, because of dense breast, they cannot find a tumor inside. That is why the mortality rate in India is slightly higher as compared to the Western population.
Wow. And you know, we know early detection, we can save so many more lives.
So many lives. I know.
And one of the problems here in the U.S. is similar to what you're talking about. Is most people who probably feel like they have it, they can't afford it, you know,
Exactly.
and so they ignore it. Another is sometimes it's hard to detect. You know, they teach you how to detect, how to feel for lumps. Like I have no good feelings in my fingers, so I really can never feel a lump. But when they detected one in a mammogram, they sent me to be monitored, right? So every 2 months they watch the growth. So these are, you know, but this costs money, and a lot of people they don't have that. So what are some good I hate saying this, cost-effective ways, because a life is, you shouldn't do that, right? We shouldn't put cost-effective on. But what are some good things that women can think about? And then we're going to talk about the difference of cancer, because I really want to get down into the inflammatory cancer versus others, and different ones that you have seen in your experience. But what are some things women can do?
About the screening methods, you very rightly said that the best screening method is a mammogram. But the problem with mammogram is the cost. And so in India, we don't have the screening practices, right? I think in US, you people have the screening programs, don't you?
Yeah, we do, but they're very expensive. We have 1 month, used to, I don't know if it still exists, but if you register in 1 month, they screen as many women as they can for free. So in the month of October, they will have women come in, and as many as they can. It doesn't mean everybody gets screened, but yeah.
Okay. That is here also we have few centers, few bigger cities, we have vans where they carry the mammography machine and then they test the women for free. But it is done for only small group of women. It is not a mass screening. Mass screening is lacking in India. I don't know about US and UK. Because of this lack of mass screening, we are not able to detect women early. And only few women who have money, because it costs a lot, 2,000 to 3,000 Indian rupees is the cost of one-time mammogram, which is quite a big cost for a woman whose monthly income is maybe just a 10,000 rupees or 20,000 rupees. It is difficult for them to undergo this test. So what in India, what we are making women aware about the breast self-examination. Right, breast self-examination is examining your breast with the two hands at your home. It is a simple procedure, and it does not require any cost. There is no equipment needed, and we are training women to examine your breast once a month, starting from the age of 20 years. Though it is not a good screening modality, it is just a woman should find a lump and should report to a doctor. The best method, obviously, is a screening mammogram. Second, we make them aware that go for clinical breast examination. That is examination by a doctor once a year when you are above 30 years of age. And if you're a high-risk woman, like you have any family member diagnosed with breast cancer, or there is a BRCA mutation positive woman, or a woman who has a breast cancer in one breast, should undergo this clinical breast examination more frequently, and mammography is mandatory for them after the age of 40 years.
After the age of 40, but we are aware that women before 40, like you experienced, the woman who was 30, some women in their 20s. So you need to just be conscious about your family history and things like that, I'm sure. But let's talk about what causes cancer? What is the biggest cause of cancer?
Yeah, we exactly don't know what causes breast cancer. There are some risk factors which increases the risk of breast cancer. The risk factors, there are two types of risk factors. One is they can be changed. They're known as modifiable risk factors. If we bring changes in our lifestyle, we can modify our lifestyle and can reduce our risk from breast cancer, like being obese. Being obese is the biggest risk factor, not only for breast cancer, but for many other cancers and for cardiac diseases and many other diseases in our body. Second is excessive alcohol consumption. 1 or 2 glasses of wine a week is okay. But excessive alcohol consumption is a risk factor, because what alcohol does? Stimulates, sensitizes the estrogen levels in our body, which is a risk factor. Then third is cigarette smoking. Cigarette smoking is now becoming rampant among the teenagers, the younger lot group. And the teenagers who, it sensitizes again for the increased levels of estrogen in our body. Then another one is like women are getting married late. They are following our Indian women are also following the Western culture. They don't want to get married before 30. They work, they want to earn, then they don't want to make children. They don't want to breastfeed them. So these are the factors which are really worrisome. Then some women take hormone replacement pills, especially after the age of 40 or after the menopause, either to combat the symptoms of menopause or to treat osteoporosis, which is not good, because that hormone replacement therapy has increased levels of estrogen, which is not good for breast cancer. So these are modifiable risk factors. When we can modify them, we can reduce our risk. But there are some non-modifiable, like they are within us. One is being a woman. Women have breasts, being a woman, the biggest risk factor. And the second one is the advancing age. As the age will advance, there will be more radiation to our genes, more mutations in our DNA, and more risk of breast cancer. Then if a lady has a personal history of breast cancer, then the risk to the contralateral breast also increases. Like these are few of the risk factors, but there is no one cause of the breast cancer which can relate that this breast cancer is happening because of this cause.
No, and I agree that these we can't get away from unfortunately the first risk factor, which is we are women, so we have it.
We are
The
women.
other
Yeah.
thing that you discussed has always been a concerning point to me is all the hormone additives that they give you when we do start having menopause, which I've elected not to take the hormones. And I will say that, you know what? The symptoms are not as bad as I thought. Irritating, but not bad. And I've learned, one of my doctors told me if I stay healthy, exercise a lot, and he knew I always exercise. So he even told me, he goes, odds are you won't ever experience it. But that's not true. I did. But it's, we have to maintain a healthy body. But you mentioned something that was very important, and that's our natural nature course, right? We are
Exactly.
women.
Yes.
We are naturally, by nature, designed.
Yeah. But yeah, I want to emphasize here that men also get breast cancer. There are
Wow.
1% men also get breast cancer. Men also form. There is milk ducts in the men which produces breast cancer, but the incidence is very low. It is 1 in 1,000 men can get breast cancer, and we do mammography also for men if required, right? And we cannot say that men are completely immune to this disease.
So, and you mentioned some things that are interesting to me that are factors of other cancers, which are the fatty, the extra fatty stuff that we take in, and obesity, which we talked about today, which is a big factor of liver cancer, as well as other cancers. So, your husband and you kind of work in the same battlefield in many, many ways, right? It's to prevent these kind of cancers. But let's talk about what exactly, so we talked about what the risk factors are, but what is inflammatory breast cancer? What is it?
There are many types of breast cancers, and inflammatory breast cancer is one type of invasive breast cancer. It is a very rare type of breast cancer, but it is a very aggressive breast cancer. The incidence is only 1 to 5%, right? And inflammatory breast cancer, it rapidly grows, rapidly spreads, and the symptom of inflammatory breast cancer, the breast becomes suddenly, there's sudden change in size and shape of the breast. It becomes larger, it becomes tender, it becomes swollen, and it becomes inflamed. Like the whole skin of the breast becomes inflamed. That is why it is known as inflammatory breast cancer. There may or may not be any lump inside. You may not feel anything inside, but the whole skin of the breast is inflamed. It becomes thickened, it becomes dimpled, it becomes red, it becomes swollen, and it is a very aggressive form of breast cancer. The incidence is more in US and UK of inflammatory breast cancer. In India, the incidence is very less, and usually they are diagnosed in an advanced stage, in stage 3 or stage 4. And the diagnosis of this cancer, it mimics like mastitis, like somebody has got inflammation of the breast, which sometimes goes away with antibiotics, and people keep on trying antibiotics as well, but there is no response to any antibiotics. So the only modality to diagnose is ultrasound guided, either a biopsy or a punch biopsy from the skin. We diagnose inflammatory breast cancer, immediately put the patient on treatment, a neoadjuvant chemotherapy, so that we can reduce the inflammation, reduce the whole of the breast should look okay and normal, and then we perform a surgery on them.
Wow. Okay. So that's, and they need to, this would be a symptom that they could see then, right? That it would go, but that's pretty late stages. Am I right?
Yes.
So, but there are probably ways, again, mammograms, if we can get our mammograms in and things like that. At what point, say, if I feel like I feel something, who should I call first? Who should I call?
Whenever a woman finds a suspicious thing in her breast, whether it's a lump, whether it's a nipple inversion or a nipple discharge or a thickening of the skin of the breast or any lump in the armpit area, we must go to a super specialist doctor or a breast cancer specialist. Do not ignore the symptom. And I would emphasize here, please go to a right doctor, right? And avoid going to any homeopathy or Ayurvedic they say that we can treat breast cancer. Please, no homeopathy and no Ayurvedic can treat breast cancer. Go to a super specialist, get yourself investigated, get proper mammogram or a biopsy, and form a diagnosis. So that, because what we emphasize is that detect it early. If we detect it early, our journey is really, really very smooth. We will have a lesser form of treatment, lesser chemotherapy, no side effects of that chemotherapy, lesser radiation. Maybe we do not require radiation, or maybe we don't require chemotherapy, and we are cured of the disease. So, and the prognosis is very, very good when we detect it early. If we go to a wrong doctor, the time is like we are wasting our time. And during that wasting of time period, the stage of the cancer advances. So it is mandatory we should go to a right doctor, get ourselves checked, and make sure that we are in right hands and getting the right type of treatment.
Well, that makes sense. I mean, I don't go to a heart doctor when I injure my knee, right?
Yeah, exactly. And in India, like we are because of embarrassment or fear, or we feel shy, we tend to find a female doctor who should examine our breast. And by the time we go to a specialist, we have already lost 1 month, 2 months, which is a very, very important period for us.
No, and I agree that we needed to be a little more on top of early screening, early detection, because when you do that, the treatments might be less that you have to do to contain it. Again, I've kind of been through the process because the insurance companies, they don't like to just dive in and start paying for treatment. So they go, well, let's measure it for 6 months, right? And see how fast it grows. And I go, can't we just take it out? Why are we measuring? Why are we testing? Why can't we just remove it? And they go, well, let's just, and so then we did that, and then it was growing fast. And so they decided surgery, right? Let's just go ahead and remove it. So, but surgery is not always the answer. Am I right? There are other.
Exactly.
So share with us some of the processes that can happen. What are the options?
Options of treatment. So if the breast cancer treatment is a multimodality treatment. Surgery is not the only treatment required. We feel that we have removed the lump, or we have removed the whatever abnormality was there in the breast. Now, why do we need the further treatment? Treatment of cancer is a multimodality treatment, which includes surgery, a right kind of surgery, whether a complete removal or a breast conservation surgery, followed by chemotherapy or a radiation therapy, or a targeted therapy as well, which consists of Herceptin if the person has a HER2 positive cells, or a hormonal therapy for 5 to 10 years if the patient has an ER/PR positivity. So the treatment options will depend upon person to person, and treatment options are personalized and customized according to the patient's stage of the disease, grade of the disease, the type of tumor it is, how many lymph nodes are involved, what is the ER/PR status of the tumor, what is the HER2 status of the tumor. So many factors decide what type of treatment will be given to a particular woman. So no one type of treatment is not given to everyone who's diagnosed with breast cancer. So that is the point here.
No, and then that's what, the thing is early detection, and it doesn't hurt to make a relationship with a breast cancer doctor. If it comes up negative, that's great. I mean, that's
the best news. That's the best news you can get. I know, because 80% of the lumps in the breast are normal. They are benign. So don't worry that if I have a lump in the breast, it is always a cancer. No, there's no need to panic. Go to a specialist doctor, get the biopsy, and maybe it is a benign tumor for which you do not need any kind of treatment. The message here is detect it early, go to a right doctor, and get yourself treated. That's it.
And that's, and that should be with anything. That shouldn't just be breast cancer, folks. I mean, that's anything. If you detect something is wrong with you, if you feel a lump in your chest area, maybe start with the breast doctor, and then they can go, you know what, you really need to go see a skin doctor, or you need to start with using your smarts. And We talked about some of the possible treatments, and unfortunately in medicine, sometimes some treatments, they have side effects. So what are some of the side effects of the treatments that we're talking about here?
Yeah, the main side effects are with chemotherapy and radiation therapy, and the side effects will depend upon the type of chemotherapy drugs and the doses of chemotherapy drugs. And each patient will have different types of side effects. The main side effect with chemotherapy is loss of hair, the alopecia, which usually happens in 90 to 95% of women, right? That is the main concerning effect when woman goes bald and she doesn't like it. That is the main thing. Then there can be vomiting, there can be nausea, there can be pain abdomen, there can be fever because of the low counts in the blood, there can be constipation or diarrhea, but there are very mild symptoms. Nowadays we have so many good drugs, we give pre-medication before the chemotherapy, so all the side effects are very, very less as compared to the era a decade or 2 decades back when we used to have so many side effects with the chemotherapy. And with radiation therapy, there are in the initial stages, there can be redness of the skin becomes darkened, or there can be superficial burns over the skin, or if it is a breast conservation surgery, the skin becomes thickened, hardened, but eventually these all side effects are reversible. They are not permanent. Here comes the skin starts glowing, the numbness in the hands and fingers goes away, and you look absolutely normal after, you can say, 3 to 4 or 6 months after chemo and radiation. All the side effects are reversible, so there is nothing to worry. Don't panic. You will get your normal skin, normal hair, and you will look beautiful as ever, as before starting the treatment.
Yeah, and that's the thing right there. Just like other parts of our body that we learn today kind of regrow. We learn the liver regrows, the skin regrows, right? We recover. There we go. I don't know. Is this a typical what you would consider a good description of the types of breast cancer?
Yes. Perfect. The most common type of breast cancer is a ductal breast cancer. This is an invasive ductal carcinoma. It occurs in the milk ducts, right? And the second commonest type of breast cancer is the lobular breast cancer, which occurs in the lobes. You're showing the milk gland. These are the lobes of the breast, which happens in the, this is the lobular carcinoma. Then there is a mixed tumor breast cancer. It can happen. Then there is a mucinous. Mucinous breast cancer is a type of ductal breast cancer, invasive ductal breast cancer, and it has a very good prognosis. Yes, very good picture.
No, and it helps to have the pictures so that we can understand what's going on. With this being the one of the number one causes of medical problems and death is probably, I can't imagine the cost of this on our countries. It's not just India, okay? It's a global problem. Women's health in general is a global problem that we need to address. And one of the reasons is because of poverty. Majority of the women do not have the sustainable income to maintain a healthy maintenance, just healthy maintenance, right?
Yes,
and we need to change that. As a team, I think it would be great globally. We talk about the WHO, the CDC, and all of these companies and organizations that are funded by our governments. I don't really, they talk about it. I don't see any wheels spinning, right? With all the money invested, you would think that there would be some more answers for you to be able to treat more patients, right? And that would be nice. That would be nice to get more answers for you. What are some of the tools? It cannot be inexpensive. You're talking about a mobile screening van, right? And it travels. This is going to be very expensive.
Yes, it is. But India is a developing country, and this is the financial constraints are the major problem in India dealing with breast cancer. Once a breast cancer treatment, I think it costs 4 to 5 lakhs if it is Herceptin negative tumor, and if it is a Herceptin positive tumor, it may cost up to 10 to 15 lakhs, which is a very, very huge cost to the pocket of a middle class family. And but we have good government hospitals. There are many charitable charity organizations which are helping people, but still women who are from a very low socioeconomic status, they don't want to come up. They don't want, they just hide and sit at home with the disease in their breast, because they think that it's a very long treatment, it's a very costly treatment. They are going to chop off my breast. How will I live? How will I survive? So the issues are there.
So I because of what I do in as an entrepreneur, I get reached out to by a lot of people with new technologies and ideas. And, everybody has a reason why they get involved. Just like you shared your story. Why did you become a breast cancer doctor? Why not something that, and it's got to be happy endings, but I'm sure you have a lot of sad endings, right? And the sad endings generally come from the fact that we did not early detect. Am I correct?
Yes, absolutely.
The other sad endings are probably the women who choose not to do one of the options, right? And maybe it's because they can't afford it. Maybe we can fix that problem. I think as a global community, we can start fixing that problem. But early detection, that has always been in my mind, why can't we do more? And so there's a thing called screening, right? Kind of like pregnancy screening. You have the at-home test. It's not 100%, but if it tests positive, you could do what? You go see a doctor, right? An OBGYN. So what if we had an at-home screening that maybe wasn't just, feeling and checking, but an at-home scanning, not 100%, that says, hey, there's a reason you might want to go see a doctor. Would that be worth it?
Yeah. At-home screening, right now we have just two hands.
But what if we come up with a means to, and what happened is these people came up with, and it's still in test, but can I share it with you? It's an app for at-home screening. It's not 100%, but when I heard you were coming on, I wanted to share it with you. Again, it's not finished, but it's for conversation. What if we can do something like this? And can you share it? Can you share it? I can't hear anything. Can you fix it? Can you fix it? We can't hear it.
Impact. 98% of women who detect breast cancer
Can
have a positive impact on their diagnosis. Today, there are many tools available to help women promote better breast health, and you should see your doctor to find out what is appropriate for you. Now, thanks to the team of doctors at ThermoGo, there is another tool to help women take control of monitoring their breast health. Introducing Stay Abreast Early Detection System, a new, non-invasive smartphone-based app that gives women of all ages the power to detect signs of spotting physiologically similar tissue to breast cancer early, in the comfort and convenience of their home. Stay Abreast EDS utilizes infrared thermography, or thermal imaging, to detect hotspots within the breast. Thermal imaging is the earliest known form of discovering physiologically similar spots to breast cancer, and the doctors behind the development of the Stay Abreast EDS app are some of the most experienced with thermal imaging technology in the world. Stay Abreast is easy and convenient. It quickly installs on your Apple OS or Android smartphone. When connected to the included IR thermographic camera, Stay Abreast EDS uses thermal imaging to analyze your breast and identify possible areas of concern. Once you take a photo of your breast, the Stay Abreast EDS app removes any semblance of your body or breasts from the photo. Blockchain security and image manipulation means your information is secure and no potentially embarrassing photos are kept on your phone. Stay Abreast takes no more than 6 minutes to complete and is 100% radiation free. Stay Abreast EDS provides women of all ages the peace of mind that they are doing all they can to promote better breast health and live breast cancer free. With your contribution, Stay Abreast EDS can fulfill its global mission of becoming the front line of spotting physiologically similar breast tissues to breast cancer in women around the world. So join the Stay Abreast team to receive early access to the app and exclusive discounts on pricing. Stay Abreast EDS, monitoring your breast health in the comfort of your home.
Now, I want to do a disclaimer. First off, this is all science and technology that is evolving and research for the good, for quality of service. It is also not intended to be a breast cancer detection,
Exactly.
It's an early detection screening system. It is not to replace your doctors, okay?
Exactly.
Something like this, cost effectively, if it evolved, could help you.
Maybe. Yeah.
You know, for people like me who don't have good I don't have feelings in my fingers because of a spinal disease. It's hard for me to feel the lumps. When they told me I had a big lump there, I couldn't feel it. As soon as you can't feel this, and I go, no, I can't feel it. So,
and sometimes, we have to really poke inside to feel it. And sometimes it is so deep seated, we have to really poke inside. We can't feel it.
And it's all that, and I'm gonna tell people, you know, I hate bringing this up on national TV or international. It's breast is fat, okay? So you got to feel around fat, okay? Have you ever felt around fat in a chicken? You can't feel anything like fat in a chicken.
Exactly.
I hate using that as an example, but that's the only other cold meat I've felt around, you know, trying to clean out a chicken or a turkey. But I'm sitting here going, you know, so. But all that is if you've ever played with infrared scanning, which I have done many times, you know, you can see the different heats in your body, right? So what you do is you just learn different parts of your body in the infrared. Artificial intelligence will take a look at things, and maybe you get a baseline, right?
Okay.
And then the AI will watch, hey, this baseline big spot seems to get bigger. You need to go call your doctor. And again, it's not meant to replace your doctor. It's just kind of meant to replace this, right? But tools like that could help. They're very cost effective once they become an app. That camera, that camera right now, you know, is very expensive because it's in prototype stage, but it's intended to cost less than $200, less than an iWatch. When it goes out to market.
Let's see what,
Just something, and maybe I can send it your way to play with. Maybe I can let you look at it and play with it. Again, that's just one. There are thousands of them, right? There are thousands of people trying to come up with an answer. But I think majority of them is because they've had somebody die of breast cancer that get early detection, and they go, why not? You know, so go ahead, Ankit.
Yes,
so, ma'am, can we have a mobile mammographic machine so that it's easy for us to carry it wherever we want and we can get the testing done?
Yeah, we discussed. Yes, we discussed. We can have, but I don't know what is the film quality of that mobile mammography machine, because now we are coming up with digital mammograms, which have lesser radiation, better film quality, and we can better diagnose it, the small calcification stage 0 disease. Now we have another new evolving technique, that is the DBT. That is a digital breast tomography, tomosynthesis, right? This is a 3D mammography, which is now becoming very, very easy tool to diagnose breast cancer in younger women who have dense breast. It's a very good screening tool for younger women. So we are evolving with the new mammography machine to pick up the cancer early, and to increase the sensitivity and specificity of mammography, because simple mammography film sometimes doesn't tell us anything.
No.
10 to 50% of time, it cannot detect cancers. Mammography mostly cannot detect lobular cancers, cannot detect sometimes inflammatory cancers. So mammography is not a 100% sure shot answer to everything. right? We have to be vigilant. We have to we have to go to a doctor. We have to be vigilant enough. No,
You know,
but
when they detected potential situation, they didn't go to the mammogram. They went to ultrasound and what you're talking about. They went to digital mapping and screening as opposed to a mammogram. So, and then they would have me do both. And I don't know if they were thinking, which tool works better, but I would,
yes.
yeah.
Yes.
So,
And in younger women in India, we are doing, even MRI is a very good tool, but MRI is equally very costly.
Very
And
costly.
MRI, the woman has to lie prone. There has to be contrast should be given. A breast coil is must to do an MRI. It's a very costly thing, like 3-4 times to the mammography. But sensitivity of MRI is excellent. It cannot miss cancers. Right? We have many screening tools, many imaging methods, but the cost then comes in our way.
No, and the thing is like the ultrasound that they were doing when they finally realized that might be the best way and they were measuring it. To me, that was the most comfortable. All right, all the other like the mammograms and stuff like that was not comfortable.
Yeah.
But the ultrasound was to me. But each tool detects something different. This is what I tried.
Exactly.
That sometimes they have to do different tools to figure out.
Yes.
Because each cancer is different, right? There's more than one type of breast cancer.
Yes.
And and I know that one of the things they did before they, what do you call it? They took out a sample. They injected radiation seed, right? So they injected a radiation seed to see the growth better. So they implanted radiation seed next to the cancer. I thought that was interesting. But I learned a lot. I don't know everything, why they do everything, because I didn't want to ask too many questions because I know they're busy. You guys are busy, right? So having these kind of conversations on TV are probably helpful. But so another question is if I have breast cancer treatment, can that be dangerous for me to have a baby, or should I wait? Is there a time I should wait to have a baby?
Yes. If the lady is unmarried, if she's nulliparous, if she wants to have children after the breast cancer treatment, she must discuss with her doctor about preservation of her ovaries, because the chemotherapy damages our ovaries to some extent. The damage can be a permanent or it can be temporary. If the woman is really young, the damage might be temporary. She might resume her periods after chemotherapy or a year later, and she can start forming eggs and she can conceive. But we always take a fertility specialist consent, and we send the patient to a fertility specialist. She counsels the lady about ovum preservation or an embryo preservation if she's married, and then we start the treatment. But there is little bit delay in starting the chemotherapy because of this, because they have to mature the eggs, then take the embryo, fertilize the egg, then take the embryo. It takes almost 1 to 2 months, and the treatment is slightly delayed. Then we also have GnRH analogs, which slightly preserves the function of the ovary. So the main emphasis here is to preserve the function of the ovary. We really do the counseling with the lady and with her husband that these are the treatment options. What do you want? It is must. It is really criminal if we are not discussing these options with the family and the couple.
No, and that's, and I guess that does become a conversation between the patient and the doctor.
Exactly.
Because those are a lot of things to take into thought. Because of my age, I don't consider those kind of things anymore. But when we talk about,
but if the lady wants to become pregnant, if she wants to conceive after the treatment, she can go ahead with that. I have a couple of patients who have taken the whole chemotherapy, treatment of breast cancer, and after 2 years they have planned pregnancy, they have conceived, and 2 of my patients, they have grown up children after the breast cancer treatment. So it is not a big thing, but you have to really plan everything beforehand.
Right. So another question, actually, because it came to my mind when I had to have all of the surgeries, is you know, there's a lot of guys here, but one's a doctor. The women, you know, this is our breast. Our breasts are pretty. The surgery can be very invasive at times. Used to be, right? Very, but now the surgeries have changed. They're not as damaging, but it can just really destroy the skin. It doesn't look nice. So what you know, what would you say to a woman? And I know we should always put our health first, but how can you tell a woman we can do this better? You know, what are the effects of the surgery physically?
Yeah, see, breast cancer, the word breast cancer is really, really, really disturbing to the woman. It is concerned with her femininity, with her body image, with her sexuality, right? Breasts are very dear to a lady. It makes a woman, right?
Right.
Telling her that we are going to remove your breast because of the breast cancer is the most annoying thing a lady wants to hear. We have so many good options now. The medical treatment has there are so many advancements been there in the surgical treatment now. We preserve the breast. We tell them, if you come to us early, we will just remove the lump along with the margin of the normal healthy tissue, and then we will rearrange your breast tissue, do an oncoplasty, so that you can have a similar looking breast as compared to the contralateral breast, and you don't need to lose your femininity. You can go home with your normal looking, cosmetic, good looking breast. So this makes them happy, this makes them cheerful, this makes them really a woman, that I am not going to lose the breast even if I have a breast cancer. So reassuring her that breast cancer treatment does not now mean that we are going to really remove your breast, give you a bad breast scar, give you a flat breast like a man. You know, I had one patient who had the breast cancer in both the breasts, and her one breast was removed almost 20 years back when I was only studying, and she came to me after 10 years, and then again she had extensive breast disease, and we had to remove her breast, and she said, "No, you will make me a man. My both breasts are gone. I'm a flat chested. What should I do?" We have so many options. If the woman does not want to go for reconstruction, we have artificial implants. We have external implants. They are silicone implants. The woman look absolutely normal after wearing them. We have lots and lots of options nowadays. So no one should worry about this, that I am losing a breast, I will now transform into a man. It's not like that. Woman can maintain her body image, maintain her femininity, and maintain her confidence that she is a woman.
And I thank you for sharing that, because that was a big concern of mine. And when I heard that, but now you're not just a breast cancer surgeon, you're a plastic surgeon too. Like you can reconstruct. You're like a plastic surgeon too. Like you can reconstruct the breast, and you can do so many beautiful things. You don't have to walk out scarred up anymore. It's hard to hear, Ankit. We're losing Ankit. We're having feedback.
Hello.
Hello?
Yes.
So we just experienced a severe earthquake in Delhi.
Yes. Everything
And
is shaking. Yeah.
Yeah, everything is shaking, and I was surprised. So I was just checking my family. Everyone is safe or not.
Yeah. Same here.
Yeah,
Wow.
it was
Okay,
a
so
severe
that's
earthquake, and I believe it's more than 5 Richter scale. I mean, I'm just waiting for the
Yes. Yeah. I
news.
can see my table was moving. Yeah.
Yeah.
Oh, wow. So anyway, this has been a beautiful conversation, because so many times we concern, but you're right. This is what makes us a woman. This is very scary anytime you have any surgery, right? Because you're scarring. I had my appendix removed, And when the surgeon sewed me up, he did a quick job, right? It was an emergency. And he left this big lump on my tummy, right at my belly, big nasty lump, right? Like it looked like a worm crawling across. And it was there for 10, 15 years. And my OBGYN felt so bad. He goes, that should have never happened. That you shouldn't have had this big ugly scar, but it never bothered me because I lived, right? That's okay. That's my memory for living. So kid you not, when he got the opportunity to have surgery on me again, like for my ovaries, he goes, I'm doing it. And he went. He went and he removed that scar. He told me, you know, women like to look beautiful. I said, you know, but it didn't bother me. This is what I told him. At first it did. And I realized it's just part of life, right? And if it looks ugly, it doesn't look ugly to my family because they go, she lived. But I have to admit, I was a lot happier when he got rid of it.
Exactly.
But he told me, I'm going to do the surgery so I get rid of that scar.
Exactly. Yeah, no scars on the body, please. No woman likes a scar on her body. Yeah.
No, there's no reason now today. There's really no reason.
Yeah. In the breast also, even if we are doing benign surgery for benign breast tumors, fibroadenomas, for anything, we give a very cosmetic scar so that it is not visible to a woman.
Yeah. Things have really changed a lot. Like you said, they no longer just remove the breast and leave you flat. They don't do that anymore. And that's why
not at all.
Yeah, and we talked about that. How long? So this is, I guess, another question that has come in. But how long, for most part, after certain treatments, and maybe it's based on the type of cancer and the stages. But say you caught it in second stage. What are the odds, and how long can a patient expect to live? Is there a life expectancy?
Yeah, the prognosis will depend obviously upon the type of tumor, upon the stage of the disease, right? Stage 2 cancers, if it is a grade 1 cancer, if it is a strong ER/PR tumor, then probably women will live her normal life. The prognosis, they say, is more than 85% for 5-year survival rate. If the woman has a triple negative cancer, which are very, very aggressive tumors, if she has a HER2 positive tumors, which are also very aggressive tumors, and if the lady is young, and then the prognosis is little bad. So we cannot assess the prognosis just upon the stage. We have to see all other factors. What is the age of the patient? What is the grade of the tumor? What are the ER/PR status of the tumor? How many lymph nodes were involved? Like everything collectively, and then we can tell that the prognosis of this lady is like.
No, and that's lovely. That's lovely. Yeah. And I would hope that we can have this talk again and talk more and have other guests on as well to talk about the different engagements of how we are changing strategies moving forward, the research moving forward, other questions. And it brings to my mind, because of Dr. Gupta, who's joined us, is, you know, what kind of pain can a woman expect to experience in different stages of cancer? Maybe that's a conversation we can have. Is, you know, I'm certain in different stages there's certain pains that women might have, and you know that is a full different conversation, I know, moving forward in a different plateau. But that's why we have Dr. Gupta on, is to talk about the different ways of treating pain and different pains, right? And but what a lovely conversation we have. Do you know Dr. Gupta? Dr. Gupta, do you know Dr. Sagu's wife?
No, I'm meeting her for the first time.
Okay. So she's actually her own doctor. So we shouldn't even say Dr. Sagu's wife. It's just Dr. Sagu is our family. So but she, by all means, should be introduced as her own person, and a fabulous.
Kim, I'll tell you, everyone knows Dr. Sagu. That's why we have to introduce like Dr. Sagu, and then we have to say.
Right. So,
everyone knows Dr. Sagu.
She is related, but the last name is the same.
I'm happy to be called Mrs. Dr. Saggu.
I can tell. What a lovely family. Wow, what an introduction he gave you. He has a lot of respect for you, and that is awesome. That is awesome. But you know, we talk about, you know, all of these different things that we go through. Even treatments can be painful or cause some pain, cause nausea. You know, sometimes it's not intended to, but that's just the risk we take for the benefit of surviving. But there are ways to treat pain, and that's where we have these conversations here is how do we deal with the pain? Because sometimes if you have to deal with too much pain, you don't heal, you know. And there's pains, different variations. Like there's the pain mentally that we suffer when we're going through finding out that we have cancer, which can be devastating enough as it is. You know, thanks to technology and medicine advances and doctors like yourself were able to say, okay, there are options to survive, but sometimes those options are painful. And, you know, Dr. Gupta, do you ever treat in pain? Do you treat patients that maybe have breast cancer or are going through a cancer treatment?
Yeah, a lot of them. So most of the patients who are ongoing treatment are suffering from pain. So it depends on the stage of the tumor, and we are generally relying on the extent of the disease. So if it's initially restricted, not much involved, so we generally manage it with simple painkillers like tramadols and paracetamols. But yes, if it's invasive, it invaded the bone or metastasized to the other parts of the body, then we might need to do some interventions to treat them or start them on opioids.
Oh, wow. Okay, so
But
there
yeah,
are various different, but again, this is what I tell people, you know, that any kind of cancer can cause pain. Some doesn't. Some you don't even know you have it, right? It's just there. But treatments can cause pain. But these are things, risks that we take to move forward to get healthy. But you have to mitigate pain so that you can heal, so that you can sleep, because rest is very important, and relieving the pain is important. You know, opioids is a big problem in this country. Probably the last thing that you guys resort to for most of the pains. But what are some of the examples of treatments that give examples of some treatments women can do while they're receiving treatments? Yeah, just things that we can do mentally to relax ourselves, maybe not be stressed out. And it could be either of you doctors, because oops, Dr. Saggu left. Okay. So Dr. Gupta, can you?
Yeah, thank you very much. It was very nice. It was very nice meeting you all. Yeah, thank you. Okay, bye-bye.
Bye. Thank you. Please join us again.
Sure.
Okay, so in dealing with things like that, what are some of the things that are good practices for, say, relief of cancer treatments and things like that? The pain.
see, first of all, reassurance to the patient is very important, and that we are always there with you. So assuring them that they'll be pain-free, they'll be having a good quality of life. It's very important to emphasize such patients that there are two sorts of treatment. One is disease-related, and one is pain-related. So both will go hand in hand. So the oncologist will take their own role in treating the disease, and we will be symptomatically managing the other disease-related problems like pain, anorexia, decreased appetite, weight loss, nausea, vomiting. Now, in terms of mental support, here comes the role of a psycho-oncologist. A psychologist who specializes in oncology patients, so comes into the picture for mind relaxation, diversion therapy, hypnosis, meditation. So here comes the role, like in other chronic pain patients.
Okay. So how are you doing today? I didn't get to ask. Everything going okay for you today?
Everything going okay.
Great. So what's the big news in your area? Normally we're all talking about COVID or something like that. Are any good things coming out of what we're been talking about researching?
Nothing. We are just focusing on telemedicine, teleconsult. We are every day seeing increasing numbers of COVID in India. And just now we experienced earthquake, and we were shaken up. I took a deep breath, and I felt my legs are moving. So I was like, how can my legs move when I take a deep breath? And suddenly I saw Ankit. So that was
And then
pretty scary.
Dr. Saku kind of did a number. So we are going to talk about that.
I'll tell you, the earthquake, it was more than 4.6 Richter scale. And that the epicenter was close to Delhi. That's why we were shaking up like anything.
Well, talking from Silicon Valley, we are not unaccustomed to that feeling. So I can definitely reach out. I can relate to it. And 4, 5, that's a little scary, but that's manageable. You'll be fine. I don't think any buildings are going to collapse.
But it can do some serious impact to the earth. You guys seem to be fine. When you said it, I'm like, okay, we'll wait and see what happens. I'm not gonna the impact of you just never know, and where it started, right? Sometimes where it started was a lot higher than where it resided with you.
Yeah.
Also, just take note. I mean, this is just my own perception, but every time I hear about earthquakes, we always see a little tidal wave somewhere. So I would say, keep our ears open out in the ocean for some movements in the ocean. And that's just my own personal observations over the years. I would always go, wow, we can almost relate a tidal wave of some sort to a earthquake. So
Kimberly lives on a coastal state, so she's sensitive to that. The tides and the waves.
But oddly enough, generally the earthquakes happen in on the West Coast.
Yeah.
But we do have them here, and it is a little bit sensitive to me, the water. But when we really take a look at some of the big tsunamis, they have been a reaction to an earthquake.
Absolutely.
And so I always keep my ears open for that. We've been experiencing weirdness. All right. Is it common to have an earthquake in India?
Not that common.
Not that common. Okay. And we've been having odd hurricanes this time. Usually we don't get hurricanes until September, maybe August, September, October, right? That's our hurricane season. What's up? I mean, we got this weird COVID thing going on. The earth cleaned up.
We also have that nature's drone, going around in Delhi and most parts of India. And those are like billions in number. And I never saw it. I've never imagined it earlier. But they said that it happened 27 years back. And those doctors, they were crazy. And I watched thousands of videos and I was like, I'm going crazy. What's happening around? And now today's earthquake, so you never know what's going to happen.
So locusts, we read about it in our historical books, our Bibles, all signs, right? When you have nature moving at this scale, these are signs to something's going to happen. And, and it could be maybe we unearthed something that we shouldn't have with the COVID, or maybe, it's just a matter of time. But now we've got all of these signs, we're sitting quiet. We're sitting quiet. We should be listening.
Kimberly, my take on this is that we are the virus and Mother Earth is sending COVID as its antibodies. And we're messing up with Mother Earth, and don't mess around with her.
And maybe she is, and maybe, our Earth has always done its own cleanup, right? Earth has always done its own restructuring whenever it feels like it. And you might be dead on with that. But I know that just before a storm here, there's certain signs you listen for, right? It becomes dead quiet. Dead quiet. You can't even hear a bug move. It's like they all crawled into their homes. The birds are in their nest.
Right.
Nature knows. Nature
Right.
feels it, right? We don't because we're too much of this and too much TV and too much everything. But nature made us be quiet. All right, we're all, or we made ourselves be quiet because of the sickness, right? Leprosy is another sickness. Think about it. Many, many years ago, leprosy nearly took over whatever countries or whatever. Leprosy was another one of those diseases that almost took over. So, and that's weird that we don't even talk about that. We always go back to 2018 with the virus. And today's conversation has been interesting to me, the difference between COVID, the virus, and COVID, the disease. Yes, Ankit.
As we just hosted Dr. Rajendra Kaur Saggu, so Dr. Rajat Gupta's wife is also a dental surgeon, and she runs a dental clinic in Greater Class, Delhi. And we would like to have ma'am as well whenever she's available to join us on IBM TV. But I also wanted to know that, sir, whenever Dr. Ma'am, some of the patients come for pain or something like that, do you treat those patients as well, or ma'am take care of those patients?
See, the concept remains the same worldwide.
Okay.
There is some professional rivalry still going on. So who is the best? So yeah, if she fails to manage her the patient's pain, then I'm definitely called in. But again, she's well at her. She knows her job, so she's managing it very well. But yes, few patients with trigeminal neuralgia, that electric shock-like pain all over the face. So those patients are definitely being referred to me because I am doing a radiofrequency ablation for such patients.
Okay.
So,
yeah, so that's interesting. Wow. So yeah, we'd love to have her come on and talk and share with us, because that's another big medical problem in the world. To share the experience, what happens when people are diagnosed. A lot of people are not familiar with that as a problem. So yeah, absolutely. But let's talk about more about some of the pain practices that we could be doing today to be preventive. Lynn, who comes on our show occasionally, he's one of our sponsors from the dollar store. They have what you call like lidocaine patches, but they're CBD, but it's got lidocaine in it, which is, you know, what, and Jim ordered them. Jim just ordered them,
Yeah.
but they're locational treatments. And I was always taught that if you know that you have chronic pain or pain that comes, to stay ahead of the pain. What are your thoughts on staying ahead of the pain?
see, it's good to be aware about your pain. It's good to, we call something in medical terminology, which is called preemptive analgesia. So you start the treatment before it starts. It gets onto you. So like as an anesthesiologist, I used to start treating a patient prior to surgery so that that patient doesn't land into chronic pain post-surgery. So similarly in chronic pain also, if you can anticipate that you are a chronic pain patient and you have attacks like migraine, so if you feel, so you should continue taking prophylactic treatments for such chronic pain. Coming back to the lidocaine patches you were mentioning, so there are very good options for people who have herpetic neuralgias or a localized neuropathic pain which is coming from nerves. So they tend to numb the area. So that's very good for local application.
Yeah, and those are just different treatments, right? Different types of treatments, non-invasive. Yes, Jim, go ahead.
Dr. Gupta, what about the chronic pain for sufferers like me? I used to be a distance runner, and so I have chronic pain in my knees and my right hip, and that's why I have the lidocaine patch. But it doesn't seem to me. It seems like the numbing removes the pain for a while, but it doesn't seem like it is really addressing the core issue. And so if someone is, and it's probably arthritic or something like that, you would know better than I, but this kind of pain, it seems to me that the more I exercise, the better I feel. And it's kind of a counterintuitive thing, because if it hurts to walk, you don't want to walk. But the more you walk, the better you feel. So I was wondering what you could tell me about managing that kind of chronic pain.
See, patients who have arthritis, maybe of the hip or of the knees, like in your case, so it's always better to strengthen up your muscles.
Yes.
So the more you walk, the more you exercise, you're going to put more strengthening into your muscles so that the weight bearing will be lesser on the joints and more on the muscles. So the whole concept comes from the fact is, if you see an athlete who's lifting a 150 kgs, a weightlifter, he doesn't suffer from slip disc all the time because the whole load is being holded on by the muscles, not by the spine. So similarly, if you focus on building up your muscles, maybe the hamstrings and maybe the hip muscles, so you will not put all your body weight while walking or while running onto your hip and to your knees. And that would ease out your pain. That's why when you walk more, you feel better.
Yes, that makes total sense.
Yeah, and these lidocaine patches, they are good for localized pain. If you have allodynia, if you have weird sensation on touching, if you have electric shock-like feeling or burning sensation, these patches are good for those pains. These are not meant to be used for arthritic pains.
Right.
So hot fermentation, local application of gels, and an anti-inflammatory like an Advil or an ibuprofen or a celecoxib or Celebrex could be a very good option for you, or a simple Tylenol, extra strength. They are good options for you.
Yeah, I tried to wean myself off of them because I was taking them because I like to golf and I would have pain. So I would take them before, and on the 9th hole, I would take some more. And then I just said, I'm taking too much of these things. This can't be good for me. So I've been trying to wean myself off of that. And I found that the exercising has really relieved, with the exception of my hip. Sometimes it flares up and it's a very sharp pain. And so that's why I got the lidocaine patch when it's sharp like that, it seems to help. But that's not a constant thing. It's not a chronic thing. It's a flare-up kind of pain. The knees are more chronic, and the building up the muscles, as you described, has been a real relief for me.
And try using local visco supplements like in Arthric. You get it on over the Costco stores. You get glucosamine and chondroitin sulfate combinations. They are very good for joint pains.
Yes.
So they act as supplements. So you can take twice a day, one tablet twice a day for a couple of months, and they can definitely add on to more pain relief. So the combination works wonderfully well.
That I also have done that, and I agree completely. For me, anyways, it worked. It helped.
It do work. Yeah.
Yes. Yeah. Thank you very much for that. Because to me, they were talking about with the hip pain, hip replacement, and that's the last thing that I wanted to do. So, managing the sharp pain with a lidocaine patch from the dollar store, and also exercising to keep the muscles strong. That seems to have been the key for me.
And it's kind of an egg before the chicken and a chicken before the egg, because you hurt, but if you do the exercises, eventually it won't hurt, and you'll get it right. And I had exactly the same problem back in December. Something went wrong in my lower back, even though I have all these other problems. We couldn't figure out why, because I stay in shape, but it so happened that I got out of shape a little bit. And that little bit of out of shape just made it to where I could barely walk, but I had to get back in shape. How do you do that? So pain medicine. I'm like, but I don't want to take pain medicine.
Right.
So we did a little bit of both, right? We balanced it, and having good doctors like a Dr. Gupta, a pain specialist, we're able to balance it. But I hope that you can get ahead of your pains, because and share your experiences with the patches, because they work for me sometimes. It just depends on the type of pain, how deep it is. But if this is what I tell people: it can't hurt you. Try it, right? It's just it's better than living in the pain. And different medications do different things, right? CBD might work lidocaine might work, but different things work. And I learned that a lot of the medications that we use for pain, this is what's interesting to me, like here in the US, I don't know what it is in India, actually comes from treating athletes first, right? Because they got to treat them faster, quicker when things that react faster on the field. So a lot of times they'll get an injury on the field and get a shot of lidocaine or whatever, and that gets them through the game. And then they go, well, you know what? This worked on the athlete, so let's try it on real people. So,
well, we see people going into the locker room looking like they will never walk again, and then something happens in the locker room and they trot it back out onto the field. So I'm not sure.
It's a lot of good speech. That's a very good inspiration.
Yes, that's right. Good halftime talk, Coach.
Yeah, Dr. Gupta can agree with me on this, that your mental state of mind can take over for you in many, many ways. So I'm sure a lot of inspirational speech, you're tired, you're exhausted, and then you get that war speech, right? We can do this, and that helps. But I'm sure that there's some other miracle things. I don't think it's the hot heat rubs anymore, but because I think their injuries are far, far greater. I did notice, like, and maybe this could be an example. I'm not that I'm a Tom Brady fan, but there for a while, I noticed Tom Brady looking stressed in pictures, right? Even though he always takes a great photo, you could just, there was something different. And he looked like he was losing a lot of weight, compared to his other pictures. And not that I pay much attention to him, but I was doing the Walter football thing, so maybe a little bit more. But this caught my eye, and to come to find out later that he had a huge neck injury and huge neck pain, and he was doing all kinds of treatments, just so that he can continue playing. And so sometimes we push ourselves past the threshold of our pain when our pain should be our threshold of what? And Dr. Gupta, we know this. Stop. Right? Pain should be that. Even though we want to take the pain medication so we can continue to do things, but we can further injure ourselves. So sometimes I think taking the pain medication should mean that you should just rest. Am I right, Dr. Gupta?
See, I believe, like fever, pain is a good sign because it tells you that your nerves are alive, and it's a warning sign by the body that there is something going on. So not taking painkillers all the time and masking your pain is a good option because you tend to aggravate your injury, which might be the case you mentioned. So you should listen to your body. That's the most important thing. So if your body is alarming you with fever, please go and get yourself tested for COVID. And if your body is alarming you with pain, please, you need to show to a trained specialist. And we are here to help you. So that's what, just occasionally taking a paracetamol, like we discussed the last time we met, is okay. But if you need them regularly, you need to go and see a specialist.
So what are some things, are you seeing COVID patients for pain? Have you been seeing any recently?
Not really. Not really. No COVID positive patients have turned up with pain. The major symptom those patients are presenting with is fever, sore throat, body aches, and generalized pain. So they're being managed with an internal medicine guy. They're not being referred to the pain specialist. So understandably, because of the fever, they have myalgias going on. But we see a lot of cancer pain patients, the majority at this time, because they need their refills for the opioids. So that's probably the reason they are turning up.
Okay. No, and that's, something to consider too, is I'm glad to hear that there hasn't been a great need for a pain specialist with COVID, right? That it's actually just been something that they've been able to systematically treat. We've had a lot of information on COVID today about how it's spreading, how much it's spreading, and the impact it makes on the human body. So that's been very informative. I feel like when we are informative and with knowledge, we're not in fear when we're having to approach it, right? Or we might be in fear, but we're in the right kind of fear because we know about it and we're able to go get the right treatment. So but I think we're at I hate saying it this way because I know we've been, not preaching, but just spreading the information that staying home is the right thing to do to avoid catching this. But I think now we've become informed enough that we know we can treat what's out there, and re-engaging with smart practices is the way we can move forward with life. And maybe some places aren't ready for it, like New York City or highly concentrated places, until you can contain it a little bit better. But I think we're at a point that we understand it a little bit better. There's no cure. And this is what I tell people: we got to approach this, that there is not going to be a cure. Not right now. The only thing we have are treatments. And I had somebody share with me the other day, you might catch one of each strain. And it said because there's 3 strains, maybe 4 right now. We don't know yet.
Right.
So the best thing to do is keep your immunity up, keep your health up, your attitude up, so that you can fight it, right? And but don't be afraid. Be conscious to call your doctor. Like you said, telepath medicine has become really big right now. But the doctors are there to take your call, to answer your concerns. If you're in pain, you can call your pain doctor and receive the right kind of treatments or information to move forward. Ankit, you're awful quiet. Are you okay? He's doing research on the earthquake that has happened.
Yeah.
So
I see. Yeah, because I was going to ask him about cricket and whether there was constant pain as a result of cricket. The way. And also in India, Dr. Gupta, maybe you can tell me, do you suffer from the same American machismo where we have to fight through the pain? And like we go into the locker room, we get an injection, we come back out and play, and then we're left with chronic pain for the rest of our lives. And so we are taught to fight through the pain. And this, I have learned from my own personal experience, is bad advice. But our society sets us up for this, so that these athletes that we admire and we're big fans of guys like Tom Brady, and although personally I'm not a Tom Brady fan, but they will suffer for their lives for playing for our entertainment.
do you have that problem in India, the macho?
It do occur. It's here also. But again, it's the awareness about chronic pain is still not as good as in Western world. So it's still, people don't understand that this chronic pain started from that injury which I had 5 years down the line when I was playing sports. So that's what we call, and these patients, a lot of them go ahead and get into a fibromyalgia kind of a state, where the pain is all over the body. And it just started with a small trigger with like an injury to the knee while playing sports, which was ignored, or which was just not properly managed. They kept playing, and now the pain is all over the body. And but again, in India, people are not that much aware about chronic pains. So we are definitely spreading awareness around that you don't need to live with your pain.
Right.
So when I was in States and when I was in Canada, I learned this thing that treating pain is a human right. So you don't need to live with pain, and that's what we're trying to spread. I'm trying to spread for the last 4 or 5 years, been working in India, that if you have pain, just taking painkillers are not the only solution. We have other treatments to manage pain. So don't make it chronic. Come to us. So that's what. So awareness is coming on. Things are improving. And we hope that we'll be at par very soon.
Well, IBM TV is well known in India. So coming on this show, you're spreading the word.
We do this, and I love having Dr. Gupta on because of my own chronic pain with my disease. But share a little bit about your story. What caused you to get into this particular part of the medicine world?
See, when I started my post-graduation in anesthesiology, I was dealing with a lot of acute pain patients, or patients who were having a lot of pain post-surgery. So that started, inspired me to manage pain, and it was very satisfying to manage pain in such patients. And then gradually, when I showed my interest, I started looking out for courses, and there was no formal training of pain medicine or cancer pain in India. So I looked out for international universities. I went through my MLEs, and I got through McGill, Canada. So I was very lucky to get through the medical school, and I did my training under Dr. Shir, who was the director at that time. And when I went there, I learned that it's much beyond, and it's very different from the way we used to manage acute pain. It's not like giving a shot of morphine, because as an anesthesiologist, if we inject lidocaine, it only works for a couple of hours. But in chronic pain, if we inject that lidocaine, even 2 cc's around a nerve, it works for 6 months. And it took me 3 months to understand that concept.
That's true.
Chronic pain,
Right. Yeah. Go ahead.
like
Go ahead.
we used to give spinal for cesarean sections, and the effect used to wean off a couple of hours later. But when we used to start doing an epidurals for chronic pain patients and injected those same amount of local anesthetic around the nerves, the effect used to last for a couple of years or even like 6 months, which was very inspiring. And as an anesthesiologist, that transition into a pain specialist, initially, like I used to scratch my head how it works. But you tend to understand that there is much more than what lidocaine does. So in a chronic pain, you have to do a multidisciplinary approach. You need to have a psychologist. You need to take the other factors into account and the other medications. So I always used to wonder, how can an anticonvulsant, an anti-epileptic, used to treat a nerve pain like a Lyrica, which is like the most commonly used anti-epileptic to manage nerve pains. So such an interesting branch, evolving every day. What I learned in 2014 has changed in 2019 and 20.
Well, my
So
treatment changed. Exactly.
yeah.
Yeah.
It's such an evolving branch of medicine, and like you just target the nerve, you go there under ultrasound or an X-ray, and you just put in 1 cc of local anesthetic with a small dose of steroid. The patient is walking happily out of the clinic, the block room, and they're very happy, and they're like, you give a quality of life to a patient.
Yes.
Similarly, cancer pain patients.
Yeah, similar in cancer.
Who are suffering from pain on 400 or 500 milligrams of morphine every day. You just do alcohol neurolysis or a radiofrequency ablation of the target nerve. Patient doesn't require any levels of opioids, and they have a new life.
That's what I tell people. They had given me so many medications over the years since 1998, and eventually did shut all my organs down. Like, your body can only take so much. But these treatments that he's talking about, like the epidural with lidocaine, I'm a testimony. Those work. I do trigger point injections, which they do 28 of them down my spine to hit the nerves. Whoa. And I do it monthly. Well, at first it was like, oh my gosh, I don't want to do this. Right. But when it was over, it was like he said, I walked out of there going, wow. And we realized for 30 days, I have quality of life. So we do this every 30 days. And I have this amazing quality of life. When it wears off, I don't. I can't breathe. I can't. I have tremors, extreme pains in certain areas. And you know what's weird, doctor? So I feel good for a year or two with these treatments, right? And then all of a sudden I can't have the treatments and the pain comes in. The pain feels worse than I remember it. Like, I'm in tears, crying. I don't remember it hurting that bad. So, there's that factor too, right? That if you can't get your treatments, you're worse. But this is so much better than opioids, drugs that put you to sleep, or drugs that make my mind funky. It is, like you said, we have made so much. So you traveled extensively for your education. How did you? This is the conversations I like to have. How did you come about or learn that you could travel and get your education like that? Did you have a good mentor?
See, I was not lucky enough to have a good mentor. I was lucky enough to be lucky to just get hold of something. You know, we Indians strongly believe in destiny. So if you're destined to happen, things happen on its own.
Okay.
So when I was doing my senior residency, what my advanced form of residency in anesthesia, I kept on trying 3 years, putting in my application for a post of a fellow in a chronic pain, but I couldn't manage it. One fine day, I just gave up, and I was like, I'm done. I just need to go ahead and do anesthesia for the rest of my life. And the last application I filled was Canada, McGill, and this was destined to happen, so it happened.
Wow.
And I'm just in love with my specialty and just love doing what I'm doing.
Well, I do too, but think about how much more you learn when you travel, right? Yep. When you study abroad, because you learn so many different things, but you also made those connections and you can share those resources, right? Because studies are different in different countries, right? Applications and research and things like that. But you share, now you're sharing your research from one country to the other. And I think that's beautiful. That's why I like our conversations at IBM TV is global, right? I learned so much by the way that the doctors study in India or in Canada or in Italy. There's just so many different things going on, even just the way we handle COVID, right? And it's not that there was a right way or a wrong way, but what we've learned are steps that we could take in the future for pandemics, right? And again, not right or wrong, but what was good steps for a big, highly dense city? What was good steps for a rural area? Because rural and dense is two different ways of things, we're experiencing deaths in both of them for different reasons, right? Just, one because they don't have the medical facilities and the other because they don't have enough medical resources and facilities. So, so these are things that we're learning. I learned something from Iceland that they experienced 10 deaths and very, very few infected. They got infected, but they managed different. They had a pandemic policy and team.
That's right.
And when one person was infected, they dove in on it because this is a small country. And they immediately, but instead of testing the sick people, because they knew they didn't have enough test kits, they just said, okay, you're sick. Here's some treatments. We'll treat you. Go over here. We're going to test the people who aren't and try to figure out where the hot spots are and control it. Different ways, right? India was very smart. They quickly shut down. You're a very dense city. So you were thinking, let's quickly close the way that this is transferring, make everybody safe. Let's live through this, live and let live. Let's live through this and figure things out. So but I've learned so much. I've just, the knowledge from one country to the other. Do you work with other countries in your practice?
Yes, I do. I was traveling to Canada in last year in November. So the teachers who taught me, I went there and shared my knowledge and shared the skills which I learned over these 4 or 5 years since I was back. And trust me, I was able to tell my teachers that this is the way things should be done. And he never used to practice that intervention, and he started doing that. And we do share emails on a monthly basis, and he shares his experience, and he's very glad that I reassured him about the technique, that it works, and I have done so many cases. So that sharing of knowledge keeps on going. And when I was small, somebody told me that the best method of investment is two: human resources and tourism. So the more you travel, you learn, and the more you share your knowledge, you learn. So I think traveling, that's why I feel so confident, because I've traveled to almost every part of the world and learned bits and pieces from everywhere, the goods of everything.
That's one of the side effects of this COVID, is that we can't travel anymore. and we're shut down, and so we can't interact. I used to go to Europe regularly in different countries, and I always had it. I felt like my eyes were open. When I can go about my business, I can almost be on autopilot here in Silicon Valley. But when I'm in another country, I'm always alert and aware. And so I am learning, no question about it. But I'm deprived of that now. I am here, and I can't travel. But I did want to ask you, Dr. Gupta, one other question. Yeah. You talked about believing in destiny, and that there's strong faith in that in India. And I was thinking, you can be, if you sit back and are passive and just say, oh, destiny is going to happen, whatever, I don't think it's the same as going into action and acting on the opportunities that were presented to you. And you have to own that, Dr. Gupta. You went to Canada. So
that's right. He had a choice, and you're right. But destiny kind of blends, right? We do things. If he didn't make that application, that destiny would have never happened.
Right.
So you have to make and do things in order for destiny to fulfill its.
There is one school of thought also. They say that the destiny makes you do what you're supposed to do.
Yes.
So if I was just trying to meet you today, I was online at 9 o'clock. So
yes.
There's a lot of school of thoughts. So probably it's a big debatable topic. But yeah, definitely you have to make an effort. You have to work hard for that. Yes, Ankit.
I believe that destiny is for doers, basically. People who are doing a lot of things, they end up getting a lot of things done from themselves.
Exactly.
People who are sitting and waiting for destiny to work like that, it won't happen. So you have to do a lot of things, and that way you can open your gateways and you can meet a lot of people. I still remember the way I met you for the first time, and now we are here on IPTV. So it's all about destiny, and that's what's happening around. And during this past, so I was counting how many people or guests have been on our show since we have started this special season on COVID, and the number is more than 100. And we never imagined that we crossed more than 100 people coming from different parts of life, different countries, joining us on the same platform, discussing about something which is happening to everyone at the same point of time. So that is a part of destiny. And I think maybe down the line, 5, 10 years, 15 years, we will remember the memories or things we have been done during the lockdown, and the way we talk, the way we share the best practices, and the way we talk about the one world. And that is what the destiny is all about.
Think about that in itself. 100 people that we probably should not have met because of COVID.
Yeah.
Right? If this was a conspiracy worldwide to divide, because they say divide and conquer, right? So immediately when you lock everybody down, what do? You prevent the ability to unite and fight back. So, and I watch I worked for Homeland Security, like as a consultant for a while. I went in and trained them, do some things. So my mind is always like, what's going on? But we united. We didn't divide. Okay. And then that is what makes destiny like what we're talking about today, right? Is that we were doing things that destiny wanted us to do. We execute. The option was there. Jim could have said, you know what, I'm not going to go on IBM TV, but he didn't. He said, I'm going to go check it out and see. And now he's become part of the family. Dr. Gupta could have said the same thing, but he didn't. But he travels all over the world. But think about this, where like Dr. Gupta was probably used to traveling around the world like Jim or even myself. I was traveling 85% of the year. I've still met 100 people, right? Your message is going out to, we don't know how many millions of people. We can't even keep up with it anymore. We see a number up here, but that's just unfortunately my Facebook page. But the viewership goes beyond. Well, I have to put one up there. You have to select one that it goes up, and that just happens to be the only. But what I'm telling you is your message goes out, and it keeps going out, and it keeps spreading. I can't believe how many people just keep clicking and looking at different things. But these were choices we had to make to do something. Like Nick and I said, we could have chose to stay home and do nothing, but we chose go forward. Going forward, I've met some beautiful doctors. I've learned some things I can do myself. And maybe we've shared that message to other people. We've met some fabulous celebrities I would have never met before. And we've made celebrities. We've actually created people who are now people go, hey, when is Dr. Gupta coming on? Or, hey, when is Dr. Sagu coming on? So, you know, but that your fate is sometimes in your hand. Do you go on the show? Do you go to Canada? You know, and those are choices you make. But I think whatever choice you do make, when you do take something, a fate happens. Another door happens, right? Regardless of what it is.
And Kimberly, you're really opening up my eyes about this, the concept of me being sheltered in place and just stuck at home. And here I am talking to two people in India and one person in North Carolina.
Exactly.
So I'm not sheltered in place alone.
No, you're not. That's what I told people. Your choice to be sheltered alone is your choice at this point. It's like when somebody says, man, I went to Vegas and had a boring time. I go, that was your problem. I hate saying this because I am not a fan of Vegas, right? Maybe it'll change and clean up, and then we'll
go to Fresno and have a great time. So
there's something for everyone. Like you, if you're an outdoorsman, go to the caverns or go to the canyon, go to the river, right? If you're a person who likes extreme sports, go hang gliding or go on the roller coaster that's at the top of that freaking building, you know. But I'm sorry, or you know, there's something to do 24/7. You know, 24/7. And in North Carolina, you come to me and you go, you're bored? I go, I agree with you. This is not a place to go to have fun. This is a place to go to rest, camping, maybe hiking, eat pork, you know, get obese. But this is not the place to go to.
I remember when I was traveling to Vegas, I took my family down to the helicopter down to the Colorado River. And I took the boat, and when the helicopter was coming up, and it was like moving like this, it was very scary. But and I remember the first time I walked on the skywalk.
Yes,
that was very scary.
Oh yeah.
So there's a lot of things to be done in Vegas.
But you know what? You took the same tour I did with my family. We did, you know, we took the bus to the plane. The plane took us to the helicopter. The helicopter took us down into the river, and then we, you know, took a boat. So it's planes, trains, bus, and automobiles, right? Took a boat, and then came back. And that helicopter, it goes down steep. It goes back up. It's freaky, but that skywalk scared. What did you think of the skywalk?
Sorry?
What did you think of the skywalk? That was scary.
It was scary. You know, you can't walk. You need to crawl.
I grabbed my son.
I had tears and I was crawling. I couldn't walk. Even if I knew that the glass will never break, but still I couldn't walk.
You know, what if an earthquake hit? That's all my brain kept saying. What if an earthquake hits right now? You know, I grabbed my son. We got around him, and that was it. I did it once. I will never go back. You know, it's like there's these in some of the buildings. They have the windows that you can walk out on and look down. I just don't prefer. I don't like those. But yeah, the skywalk was insane. Dr. Yu, hi.
Yes.
How's California?
Today it's overcast, which is nice. There's a little misty rain, which is good because it's been hot lately. It's probably DARPA putting out the chemtrails to make us less healthy. That's what I figure. Yeah.
We're talking about all the healthiness of it. So something I don't know if you're aware of, but in India they just experienced a earthquake.
Yeah, I mean, there's a lot of worldly events that
I'll take your leave.
Don't hear because of COVID taking over the news. Like remember that asteroid that almost hit the Earth?
Yeah.
That never made the main news. And then earthquakes, and remember that cold storm that hit the US a couple weeks ago? I mean, it's weird. Weather's
Yeah,
been weird.
It snowed up in New York, and we had icy hail, and then India got hail. India had hailstorms. So,
Well, you wonder if the weather is being manipulated as well to keep the temperature cooler, and that's when viruses tend to flourish.
well,
Because when it
Jim,
gets hotter,
yeah,
they can't survive in hot atmospheres. So it's
I've
kind of
just
strange.
met Dr. Yu, but I've fallen in love with him. This is great. It's all
So
being.
Dr. Yu is in LA area. He has a stem cell practice. He's a chiropractor as well. And we've actually seen him video a treatment when he injected a stem cell into a patient and the success. So it's Dr. Yu is full of great surprises, alternative treatments to most of the dangerous medications that they tend to offer us. But a chiropractor, that's what they do. That's one of the reasons why I like chiropractors is they're more about all the alternative quality of life, preventative that we can have. And but he's also an entrepreneur in many ways too. So he doesn't just stop.
Serial entrepreneur.
Serial entrepreneur, but he's a health geek. And he even he realized that we put on the COVID-19. He goes, let's do a yoga class. And what does he do? Like in less than 24 hours, throws together a hot yoga class. And
well, I'm gonna break down each movement one day.
Yeah.
And then that way I could kind of, because there's so many nuances. It's like a golf swing. You have to evaluate from head to toe. There's so many things that can go wrong. I just started a video series on neck stretches for my patients and back, and I'm gonna put them on Facebook. See if people watch them. So yeah,
I will. The thing is alternative treatments like that are very good. I know that I have to do physical therapy every day. Stretching is one of them in order for me to continue walking and having good movement. Also keeping my weight down, which is very important. But my problem is that after a while it gets boring. And learning new techniques or just seeing somebody else reemphasize why something's important is always fun for me to watch, right?
You have to do something you like. Otherwise, you're not going to keep it up.
Yeah.
So I always encourage, find something you like. I mean, some people don't even like walking. If you don't like walking, bike. Don't like biking, swim. Don't like swimming, do the Katsu bands. I mean, anybody can put these on their body and press the button, right? And then guess what? You're getting a workout in. So I almost got the website built up where you can order them. Because it takes a long, because you have to put on the shopping cart what size, right? And yeah, it's a lot of moving parts. And then, of course, PayPal banned our account for no reason. We thought it was because we sell CBD, but they didn't tell us. They said, our request to establish our PayPal account's been denied. So now we got to use, I think you could use SurveyMonkey to get payments. I don't know what we're doing.
So we got an online, Ankit, don't we have a partner now that we're working with, Sinjay? Ankit just jumped off. So we've got another, I guess, a fintech company that helps businesses with electronic payments as well. That we just is doing a TV show with us now. So Sinjay.
Well, Dr. Yu, I've got a PayPal account, and they didn't turn me down. So.
Well, you don't sell controversial products like me, like CBD roll-on,
how controversial
consultations, stuff Big Pharma tells PayPal, hey, shut this person down.
Gotcha.
People are drug profits, right? We got to sell opioids and kill 100,000 people. That's what they say. Yeah.
You're not the only one that has struggled with PayPal shutting down on them during transactions. I've had small businesses in Miami complain about it. In fact,
even Chase Bank, they've withheld $28,000 of my income because I had some fraud on my account. So I changed my account numbers and they haven't transferred that 28 grand from my old accounts to the new. They said it's in suspension. And no matter who you talk to there, it's like talking to a wall. They just read a script, and
Completely.
all these people have no soul in these big corporations. You know, it's crazy.
It's crazy. Big pharma shouldn't control people's businesses and transactions. And again, I have friends that have small businesses and down in the Miami area, and PayPal was causing all kinds of problems. One, because one of them was a new startup, and they were getting a lot of money coming in, and PayPal just all of a sudden said, no, I don't think so. And nothing was proven that they were wrong. And, you know, maybe they were a competitor to somebody else, but.
Well, you know, I heard Miami's starting to open up movie theaters, health clubs, but I heard that somebody who owns a chain of health clubs got a call from the WHO, which they're out of their jurisdiction. It should be the local Miami Health Department. And they were saying, oh, we don't recommend you open up because COVID's been shown to be transferred through sweat, right? Which hasn't been proven, right? We know it can be transferred through respiratory droplets. It's almost like they hired people to call all the businesses and health clubs not to open. And I think it's just an excuse for them to say, oh, don't open up until you take our vaccine. You know what I'm saying? You know, trying to scare people like, oh, it's not safe to go out until you have this vaccine. And they want to, you know, scare everyone and to stay inside, you know. And then I'm going to say this over and over. I'm not putting that stuff in my body just because I know what the ingredients are. I mean, known toxins and, you know, blood products from like cows and different animals. I don't want mouse DNA in my kids, you know, in me and my offspring. You know what I'm saying? I don't want aborted fetus parts injected in my body or my kids, just as an ethical standpoint. Well, or mercury, thimerosal, you know, known toxins. Just like I'm not going to eat GMO foods that was sprayed with Roundup because DDT is a known carcinogen. That's what they used to deforest the jungles in Vietnam, and then these veterans got Agent Orange causing cancer, and they're being denied benefits. So it's crazy. I could rant all day.
No, but you know, yeah.
And absolutely, I agree with what you've been saying, and it's a question of following the money. You know, it's like, here's
the thing. All right, I get it. I mean, you know, I'm Korean. I appreciate the Korean War. General MacArthur came in. He stopped communism at the border. By the way, the war never ended. There's only a ceasefire. There's no. The war has not ended. So occasionally there are skirmishes at the border, the DMZ. Vietnam is a harder argument that we should have been there just because. Here's the deal. Vietnam was backed up by China and Russia. We know that. So we didn't even stop the spread. Saigon's now called Ho Chi Minh City. And it's like a free market society. So if we did not go into Vietnam and sacrifice all those innocent lives, 18-year-old kids, come on.
Right.
You know, would it have changed? I mean, wouldn't Vietnam eventually become, although it's labeled communist, it's a free market now, right? We do business with them and they're growing just like China. So was that really worth it? You know, JFK was against going in, and mysteriously the magic bullet, you know, somehow found his way through him. And then Vietnam was allowed. So, yeah.
That was always a conspiracy theory right there. That was probably one of the biggest conspiracy theories of our lifetime. I guess this will become a conspiracy theory as well. One of the things that have really irked me, and I don't know if this bothers you as well, but you know, in the course of all of this, some of us entrepreneurs pivoted to help distribute medical supplies, right? Connecting dots for people. And I noticed that, like, in the beginning of COVID, there was masks. Mask was a necessity. And so the FDA did approvals of a lot of mask companies, and the American distributors and chains and warehouses stocked up, right? And they have this FDA approved.
I'm stocked up, but ready to distribute them.
Ready to distribute, but then they turn around and they go, you know what?
Yeah, it has to be CDC tested and certified.
You have to be CDC,
FDA, EUA. And sometimes if they get it, the manufacturer gets it, they'll take it off the list. So you end up importing all this stuff. Luckily, this company, they got the CDC certificate, but I got lucky. Same with the test kits.
Test kits were the same way. They changed the rules in mid-game. So you got the stuff shipped in on FDA approval. Then somebody comes in and goes, only if it has CDC A list. So there's a CDC A list. And but get this, these manufacturers had to pay to get the FDA approval. These manufacturers have to pay to get the CDC approval. They have to pay to get this. So now these guys who shipped all of this FDA approved stuff here in mass volumes to meet the demand have nothing to sell right now. They can't sell it because it's not CDC A list. And these guys can't afford to pay to become CDC A list. So this
I think,
is another scam.
I think it's a gray law. It's not written in stone because these products were imported when the regulations were allowed. They should be able to be grandfathered in and sell them.
Yeah,
I have no
grandfather clause. Whenever they come in, there should be a grandfather clause, unless they could prove that these masks were not fit, and that wasn't the fact. They were fit. What happened was somebody was like, I'm not making enough money off mine, granddaddy.
Well, you could use them for general population use. You just can't say certified use for in the hospital, right? The general public is fine, I feel. Yeah.
Okay, that's what it is, though. So, okay, Cindy, we're going to add one more seal of housekeeping approval on this, and then you can sell yours and they can't sell theirs. That's what's happening. It had nothing to do with the quality of the product. But I think that anytime they do a transition like this, if you've got 20 million in stock in the country, then the people who are sitting on that 20 million should be allowed to push that through. But then the next band coming into the country should have to meet the next qualifications. So I think that there should be a grandfather clause that crosses, so that these people can move the product that they have. Yes, Ankit.
But why can't we have a global standard for everyone? Because it should not be that a qualification for US is different from a qualification from UK. So as in India, we all are human beings and we have two eyes and all those things. So I don't understand why we have
this. We all breathe the same. We got a liver. We all have a liver that grows. So why can't
I don't understand why every government wants to have a new guidelines and new rules.
I have been asking this question since I was an engineer in telecom. Why can't we have one universal? Why is it when people come out with all of this proprietary, why can't it be one universal standard?
It's a WHO's COVID vaccine. That's the universal.
Why do I have this? Okay. Yeah. Why do I have this? And why do I have this? All right. Why are my connections? Why are not one of my?
That is my complaint about Apple.
Why are any of
them? Every year, Apple is different than this one. So annoying.
So I said, hear this out. We had a telecommunications global standards committee. Global standards committee. We all had to pay our way to sit on there. I wasn't an independent at the time. I was a representative of a very large company, right? There was not one dang thing in that room about global universal standards. I learned more about what everybody else was doing and how it was all proprietary. You probably learned more about who to invest in at those meetings. And I was an engineer. I wasn't paying attention to that. But I agree with you. Why can't it be one global world thing? Why do I have to go to Brazil and get my Anvisa? Why do I have to go to the UK and get the HRSA or HI?
Brazil is so picky about import. Usually, you just pay somebody off.
Uganda's like that.
I'm serious. That's how I got my lasers into Mexico. We took them across the border through Texas, and they just paid off the custom agent some cash, and he let it through.
Yeah.
And that's how business is done in Central and South America. So why Brazil, who's probably struggling financially, making it difficult to get these medical supplies and testing and all that, and PPEs. It's all about getting more, revenue, but it's very hard. They make it very difficult. That one of my Chinese suppliers gave up on getting the Anvisa, on medical supplies and equipment. I mean, yeah.
It is very sad that they have done this to us rather than help the medical community and help the smaller businesses. And again, I feel like that this is more about the big pharma and big businesses felt like they missed out on the opportunity. And instead of giving us a chance to complete the cycle of the product we have in stock, they've hindered and all of this stuff is going to be sitting there in the warehouse doing nothing. And it helps no one. It's like ANKIT says, and why can't it all be the same freaking standard? It's the same product.
Because that makes sense.
I have an answer basically. I have an answer that all the MBAs, they are sitting and controlling the management and they're controlling the company. So they want to create their own ecosystem so that once you register in that ecosystem, it's difficult for you to go out.
Yeah.
So that's what they want. They wanted to capture in a web, and you have to live in that web for n number of years till the time you think of going back. And then if you want to choose to opt for some other company, you have to pay a lot of money just to transfer your data to the other company, and that also requires a lot of money. So that's what's happening. In fact, I've read an article last year, sometime in November, and they says that a company is working in China or somewhere. They have a phone and they have a car. So the phone is combined with the car, and you have to buy the ecosystem. All the hardware is free of cost.
Right.
There is no charge for the hardware. You just have to pay a monthly sustainable fee to manage those ecosystems, and you are for life. You don't have to pay anything. So that's what they're working on.
Right. And
they wanted to control it by using 5G, by using a lot of devices, bots and all. They wanted to know what are we talking, and then based on that, they will supply you products, which is not healthy.
Yeah.
So I will tell you this.
I look like a Papa Mole. I'm doing my warm ups. Every podcast I'm on, I'm always moving around, I'm always sitting around, right? And I'm like, I get stiff. I always move around. Like I was on a Grant Cardone podcast, and my backdoor gym. I was doing rope climbs, and people are like, "Look at what is he doing?" Yeah.
So you were on Grant's podcast. Oh wow, that's pretty cool.
Yeah, I'll invite you. It's called 10X.
Yeah, you'll have to do that sometime.
Except
he does a lot.
Well,
I have
a problem with. Have you heard the old business mantra? You're always growing, or you're always shrinking. There's no such thing as maintenance. But the problem with always growing is you're going to have to spend more time growing your business. And if you have a family and you're trying to balance that out, and your fitness and your faith, something's gonna give. So a lot of these multi-billion-dollar companies and CEOs, they're making billions, they're growing their company, but how is their other parts of their life? How's their fitness? A lot of them has a lot of heart disease and depression and diabetes and cancer. How's the relationship with their family? They're on their third or fourth marriage. With their kids, how's their faith? Do they sell their soul to grow the company? I naturally do try to kind of grow my companies, but not at the sacrifice of faith and fitness and family and all that. So I
There's
think
balance.
there is such thing as maintenance. You're never like this, but you know, I want my maintenance is kind of like, you know, I'll be up more than I'm down, but if my up is I'm selling my soul, I have to pull back the reins. Does that make sense? Although my tendency, I do want to grow. So yeah.
Well, there's a balance, and you know, in this particular situation, and I was speaking with another person. I hope he joins us here. A lot of us entrepreneurs kind of pivoted, trying to say, okay, well, maybe there's something we can do to continue generating revenue for our family during this time. Not to take advantage of people, but to help connect dots. Hey, I know someone. You know, the network thing. And the thing is that we've invested in other things and tried to help other people, and now that's being turned against a lot of the people who did that. And it
you always get those trolls. Oh, you guys are taking advantage of COVID. You're price gouging when we're just filling a need in the market. You know. Yeah.
You know who's price gouging? I'm going to tell you who's price gouging, especially when I sat here and listened to Dr. Art tell me how much he was paying to get each test kit from the government to test his patients with, because he's on the front line testing. And he was telling me it's $28 to $30 per kit. I mean, per test. Per test.
Which one, the PCR or the finger prick?
I think that right now is the rapid test right now, I think, but they do the PCR too. And the PCR, I didn't ask. I should have.
$28 a kit just to get the kit?
Not the kit, per test. So you know how the kits are priced per test, right? So
yeah.
So in most cases, warehouse prices at $6 to $10, right? It's costing them $28 to $30 to buy it. That's price gouging.
Yeah.
It's the government price gouging. That's not, this is why I tell people it's not us doing that. We're not doing that.
We have to use those kits.
Yeah, I think the ones that the state has approved for them to purchase.
Yeah, see, they want to control it.
But they have to buy it. So somebody in the government is controlling that puppet string, right? So they're saying, well, these are the only ones we're going to allow the doctors to buy in our state. So somebody's controlling those puppet strings, and that's
a little yoga every day. Sometimes I'll make it through the whole routine, but once a week isn't cutting it because I just get so tight again. I was trying to do yoga with the Katsu bands to see if I could get more flexible with the blood rushing in. It might.
Well, you know what's interesting is
open the fascia more.
I can't hear the Katsu bands running this time. The last time you had them on, I could hear it, but
it's on my waistband, so you're not gonna.
I can't hear you, but today the doctor used cameras also not clear. I can't see him clearly. Maybe my bandwidth is having a problem, but I don't know.
Yeah, it's hard
to see clear. Yeah.
Right. I can't see you very clear today. Usually you're very clear, but
yeah, maybe because it's raining. Yeah.
Yeah, it's a little fuzzy, and all of this weird stuff going on in our ecosystem. It's like the Mother Earth is taking back her control and saying, you humans got out of hand.
A lot of weird things going on, especially in India. I mean, we are experiencing different things every day, and it's scary sometimes.
It's unusual, huh? Even in India, are weather patterns unusual?
Yes.
Yeah, too much. I mean, so day before yesterday, we had 112 degrees Fahrenheit, and today we are experiencing heavy rains across North India.
Yeah, like here, it was very hot yesterday. I just finished exercising with my son at 6:30, and like at 6:45, all of a sudden it got dark, the cloud, and it started raining a little. All of a sudden, like a light switch. Yeah.
And also, doctor will tell you. So we have a natural drone from Mother Earth coming to India from Africa. If you heard about Lotus, so they are flying across India, and they are damaging all the crops. and they are flying in numbers of like 1 billion, and they are covering the area which is like around 3 miles.
Is
And they
that
are
more than
15 kilometers
is
per
that
hour.
more than usual?
Yes.
This happened
It's
27
never
years ago.
happened.
This never happened. I mean, in my lifetime.
I mean, you wonder if, like, I don't know, some organization they you know, they raised a bunch of locusts and now they're releasing it. You know, like in the U.S., they're trying to scare people. You know, those huge wasps from Japan, they're like this big. They're saying, "Oh, there's been sightings in Washington State." It's like, you know, we don't need to hear the fear mongering. You know, like I said, I haven't with the news for a few weeks, and I have so much more time. Yeah.
Yeah, I've seen them before, and I asked somebody because I'd never seen one before. It was about 2 years ago, and I remember asking people, "Have you ever seen a wasp that looked like this?" Because it was you know, bigger than normal, red in color, kind of just freaky looking, and everybody was like, "No, we've never seen a wasp that looked like that before." It's probably something that we've imported in through, you know, shipments and things like that from.
I went to my favorite taco place called Coyote Taco. It's an old Morongan Native Indian recipe, and they know me so well that they know my order. I just tell them the usual, and then now they have this. Say, oh, you have to stand 6 feet away from the window. I'll give you your bag of food. And I was clearly 6 feet away, and she's like, "Oh, stand further." I'm like, hey, "Listen, I'm 6 feet away. You know, this fake virus doesn't really scare me." And the owner's like, "You're in the medical field. How dare you?" Blah blah blah. It's like, why is she yelling at me? I'm like her best customer, and you know, I probably won't go there again. They're so stressed out. Yeah. Mm-hmm.
Has that been you know, in North Carolina, we had, you know, trying to re-enter, and of course, the best practices went straight to heck here. And we had we have race car here, right? I don't know if you're familiar with race car, but it is usually packed, crammed like this with sweaty people not wearing clothes and stuff like that. And, they decided to open up on Memorial Day weekend, even though our governor said, you know, just 10 people per event. This is their answer to it. Well, it's 50 acres of, you know, and we had 4,000 people to 50 acres. So they think, you know, 50 acres, but that's not how you cram the people. You know, 25 acres is cars spinning around, and another 1/2 acre is where you cram all the people to watch, right? Mm-hmm. So the mentality and the excuses are stupid, but it's like you said, if you're standing 10 feet away, 5 feet away, who cares? But there's just, you know, everybody has their own thing, but not one person was wearing a mask. They were all crammed together like this, but they weren't.
It's like the White House person. Nobody wears it.
Yeah. Right.
Kim, I remember the post you have shared in the morning, which was about some rally happened just after Spanish flu, and people were wearing masks at that time as well. Yeah. So masks is not something which is new to us, and then I think people are following that.
No, mask is not something new. This is what I don't understand. It's not like it's the first time we've been asked as a society to just take the precautions until we get things under control. This is something else. You know, just take precautions until things are under control. That's and we understand what we're dealing with, and that's the problem. Is people are not, you know, but like even Dr. Yu says he was standing, you know, several feet away or whatever. But you know, people need to understand that, you know, you can do that. But this is what it looked like over the weekend, and look at the stand, right? So they're going to open again this weekend.
But how come there are no news from the Trump administration so as your state government?
So Trump's biggest way of spreading news has been cut off, called Twitter. And I don't know if you've seen the news where he's going to sue Twitter, right? So his means of spreading hate and whatever he wants, his news has been cut off because Twitter. I'm sure he's twittering today about Twitter. So I'm going to sue Jack Dorsey. Okay, yeah, you're using Jack Dorsey's Twitter account to tell him that. But the thing is that you know, people are just going to do what they want to do. And at this point, this is what I say is, you know, we're just going to unfortunately have to deal with the unconscious mindsets until things are together. Like, you know, Doctor, you were probably at least being distant. You know, it wasn't like you were crammed in a crowd like this, right? I mean,
yeah, it's just a window.
might be.
Yeah, it's just a window. You know where you pick up your food, and you know,
So
I was
do
like
they
this
have
far
a-
away. She's like, all she had to do was open it up, and I would have grabbed the food. And
Or
I just felt, hey, I'm a regular here, and they're treating me
should
like
have
some
a stick.
zombie. Yeah.
They should have a serving stick, right?
Oh
They
no,
put-
they should have a place, a marker on the floor. Oh, please just stand there. But it's so vague. Oh, stand further. You know, it's like, you know, yeah.
we have at our little country store, they have lines everywhere now, like little taped things, and you know, stand here if this is happening. If this line, they have one direction aisle. I mean, it's so weird. I can't shop. I get real scared. Am I going down the wrong way? But you know, they've taken really good precautions here. But I would almost think that at a serving where they're serving food, they would have a big stick with a clip on it. They would just hand you the bag with a stick, and then they don't have to worry about it. But I'm concerned that people think we can go like this. We had a nice conversation with a young man from New York that shared with us, you know, how things are in New York, that people aren't really taking it serious. And that's why things are spreading the way they are spreading, even though the government has taken the effort to shut things down, to limit access to a lot of the activities, that people are still just going out and doing their own thing. So I guess his thing is why not just go ahead and open up these activities, and we address the sickness as it spreads. And maybe are we there yet? Do you think we can start addressing the sickness as it spreads?
Well, you know, my rant is just let the herd immunity take place. Let herd immunity take place. Turn the news off, and just do your best to maintain a healthy lifestyle. And
Yeah,
you know, test the elderly who have symptoms. Quarantine them. So if you're young and healthy, you should be out in the workforce. You should be outside, you know, getting plenty of vitamin D and socialization, to keep your stress levels down. So, because people are turning to their comfort foods and they're online all night, insomnia, which is going to cause even worse problems than the supposed viral symptoms in itself, which 99.7% of the population are going to fight off anyways, you know, or even more.
well, and I think that's what we've heard today. At least 80%, 85% of the people that get this will not need to go to the hospital. Just your basic standard treatments. But this is what we've learned through the 3 months, that you can be contagious even if you don't have symptoms. One of the things I like that Iceland did was, instead of testing the people that are sick, in order to kind of isolate where the spread could be, they said, okay, if you're sick, go over here and get treated, right? And they started testing areas where people were not showing symptoms, trying to catch it early. I thought that was very smart. Yeah. And then, but they never closed down. Like their schools never shut down. Everything never shut down, and they experienced 10 deaths and, you know, not that many people infected. You're still going to have infections, right? This is going to spread, but they controlled it. And that's what they said. We're going to continue controlling it just like this. And the idea is just to keep the mass spreading from happening so that the doctors can control the symptoms. But like you said, the elderly are the ones who the odds are against them. So I agree. I think, you know, we're just, and again.
Well, and then if we do get sick, we have the solution, you know, the umbilical cord stem cells to, you know, immunomodulate, you know, enhance their immune system, and oxygen, like the hyperbaric helmet, instead of stuffing an intubator tube down their throat.
Yeah, I
They're
love
probably
that.
doing that because they could bill insurance more with the intubator than simple oxygen. Unfortunately, economics play a role in that.
Well, and
But,
the oxygen is better for you anyway, right? It's better for all your organs and everything. We know this. So, yeah, and then maybe use one of those things that you got, right, to keep the nitric oxide pumping through the body. Very simple solutions that don't cost a lot of money pharmaceutical wise. And we know that's the problem, right, in our society. I agree with you. I think we went home with too much comfort food. They should have been sending everybody, big containers of blueberries and apples and things like that instead. But that didn't happen. So we put on the COVID-19, and we're going to get back in shape. We're going to do yoga.
I think people they're getting cabin fever. They want to come out, and so we're trying to educate people how to come out safely. Yeah, social distance. Yeah, clean mask. When you do go out, obviously if you're symptom free, I think you could be less cautious. But if you do have some cold or flu symptoms, yeah, you might want to, think twice, but at least go outside around your home, to get that light and vitamin D going, right?
Yeah, because even just because you're sick doesn't mean that you should stop getting the supplements that your body needs. And that's the reason why people get worse and sometimes maybe unfortunately die, is because they're not getting the supplements their body needs. They're not hydrating enough. They're not getting the vitamins that they need because you stay inside. They proved that in 1918 in the flu, the Spanish flu.
But Kim, you know what Dr. Sareen mentioned, that in India we took BCG vaccines when we were children, and then that is helping a lot of people, and also it because of our young population in India as compared to other countries, and also a matter of fact that in all different countries we have different kinds of disease or things happening. So like like in US, 15-20% of the people are obese, and that's why it's causing more in US as compared to other countries. So because of our chronic disease or other diseases which is going on since a while now, that is where I think COVID is spreading more. And in India there is some kind of an unearned immunity because we are daily dealing with a lot of pollution and other things. And I believe that that is causing some kind of a gateway or some kind of a shield for us, because we have always been the way we used to live, and our lifestyle is different from what other people live. But we have a lot of open things. I mean, we don't follow that much of amount of hygiene what we follow, but we have a completely different lifestyle, and I think that's why we are in a much better situation as compared to the rest of the world. But I still believe that
there's always going to be some risk of leaving your home.
Yeah.
If you get in your car, there might be a higher risk of dying in a car accident than COVID. But we still drive because we have faith that we're going to get to point A and point B without getting in a car accident. Now, you could decrease your chance of a car accident by, not speeding and, always looking over your shoulder when you turn. Try to be aware of other drivers, look at their tires, but still that's all that we could control. But somebody who's drunk at the other side of the road, they could hit you and kill you, or you could get injured, and we cannot control that. Just like our health, what can we control when you leave the home? Yeah, you can wear a mask, social distance, wash your hands. You can take vitamin A, C, D, E, K, exercise, manage your stress levels, vitamin D from the sun, healthy diet, healthy exercise, maintain some spirituality and socialization. That's what you can control. But you cannot control, somebody else who's infected or
Certainly.
where the virus happens to be. Those are factors you cannot control.
And I completely agree that while driving the car, we have a lot of blind spots, and especially the blind spot is between your rear wheel and your window. So there's a thick assembly line which causes a lot of blindfold when you take a right turn or left turn, and that happens with a lot of car accidents as well. But on the other side, I'll tell you, Dr. Yu, that everyone is talking about sanitizers and all those things, and people are keeping sanitizers in their car. So in India, the temperature is around 110 Fahrenheit. And so that is causing a lot of problems.
Yeah, the plastic's probably going to melt, and the plastic gets absorbed in your body.
And one more thing.
You're killing the microbiome on your hands. The good bacteria.
It's blasting out like anything, and then a lot of people, what they are doing is they are putting sanitizers in their car keys just to sanitize it. And once they start it, it just blows away because that key is also having that alcohol. And then once you on it, ignite the engine, it blasts away because that creates a current, and that is the cause of the problem.
Exploding. They've been exploding.
You burn your hand, right?
Yeah. There's.
I mean, it's not about sanitizing things will carry it away like anything, but we have to follow the right thing, because a lot of things which we are conveying right now, people don't understand that how to use it. So it's important how to use it.
Sanitize. Get some lemon, and wash it with lemon water. Right? It's not going to explode. Yeah.
I'll tell you, Dr. Yu, when we were in our villages, in our rural days, when we used to go to our villages, we used to clean our hands with mud. So we take some mud, put it here, and then clean the hands.
Wow.
You get the natural microbiome. Yeah, the good bug.
Those are just real muds with very thin, without stones and pebbles. And people used to wash hands like this only. They put the mud on their face. They get a lot of facial thing as well. And we have different kinds of mud. We use it. I mean, not nowadays because everything is easy. Just order dollar store and then you'll get a lot of stuff. But there are natural ways to do that as well. You won't believe. So in our ancient time, when we don't have the razors, what we used to do, you used to boil the milk, and the foam of the milk, you put it in your chins, and then use the razor. We don't use creams.
Yeah, there's no chemicals, so
there's no chemicals. And then if you apply milk foam, your skin is also good.
Well, the protein from the milk is probably really good for you as well. I learned something too. The protein from eggs is used for when burn victims. I didn't know that, but egg
powder, and you get powder on it,
okay,
butter, but egg white. The protein from egg white is also great for burn victims, but this is a natural thing, right? It's not what they use in the hospital, but it's the same compounds in an egg. Will help take away the burn and the pain that goes with it for a long time. If you get it on there real fast, I've heard of people taking egg white real fast and putting it on burn victims. People who've had serious burns. There are various ways to sanitize. I've emptied my bag. Let's see if I can find what I used to travel with.
So Kim, before that, I just played a small video, which is the new drone technology where you can get your deliveries through a drone, and you can pay to the drone as well.
No, and I think that is awesome. I was watching a weird movie the other night too, of food deliveries in a truck, but it's an autonomous driving truck, and it has compartments, right? And you go and it knows that you're there. Right, you scan, and then your food pops out. Right, so there's no people serving food, no. But there's so many things that are going to evolve from this because of necessity and having to reduce. I can't find it. I guess I don't travel anymore, so I don't. I don't have it.
There are a lot of natural ways as well to sanitize yourself and to boost immunity. And I think we have to get back to the nature, and we have to avoid those artificial treated products for our body especially. And you know that Lynn always mentioned that Dove, and there is one more brand I don't remember. Those soaps are made by milk. There are no chemicals involved, and this is good for body. So sometimes what happens is that whenever I wash my hands with some other brands, I usually feel that my hands are not good. Then I have to apply some moisturizer as well. So that ways, I think natural is something which we need to take care of, and we also uh, we also learn how to grow our own plants, how to grow our own vegetables, so that we can self-rely on self, and we don't have to go out and buy basic stuff. And I think, Kim, I can see. I've never asked you, but I can see a good view from a window. And I always forgot to ask you. There's a small, tiny plant there, and there's a stool as well. So, what is that plant?
So I have a typical Southern house, a big front porch, right? And it's covered so that you can still sit out there in the rain. In the winter times, it's not as comfortable because it faces north, but in the summer, it's very comfortable because it faces north, right?
Yeah.
So that's a plant. It's a flower plant, and it's one that I actually grow in the house year round, and I keep multiplying it, called Vinca, and it blooms year round. So I keep it inside. It gets really big, and I just keep planting more, right? The deer love it, so I don't keep it out very often because the deer will chew it down to nothing, but it grows beautiful inside. I have beautiful pink blooms year round because of it. But I have a garden in the back, which is big, but not doing good this year.
Okay.
I'm really disappointed. We put in new compost. We bought compost. We make our own compost too, but we wanted to expand. And I guess it was the wrong kind of compost, so none of our seeds came up. We did seeds inside, and those are doing better. But yeah, no, that's my front porch. It's there's a porch chair swing that's really, just to sit and rock, and then a table is out there to sit and just relax. I go out there for Alexandra's cafe show. That way, even if it's raining, I still have a nice place to sit. And thank you for asking. It's a nice place to hang out, get fresh air.
Yeah, and we miss those backyards in India because it's not that easily available because of, we are living in such a different so we don't have that. But if we go to countryside, we have bigger houses, farmhouses, and people have maintained their farm like anything. And so I always feel that why we are living in a state or in a city which is so much of crowd with a lot of pollution and lot of things going around. And you won't believe that in India, all the top cities, means all the metros, they are suffering from COVID. Countryside is all beautiful, everything is fine, people are enjoying and people are having a good time. But when you talk about those metro cities, those are the cities where you'll get business and people come there for good money and all those things. But they don't realize that it hampers the health as well, and so as a lot of other things. And then whatever happening in the world, it will firstly grab to those metro cities, and then it will go to the countryside. So I always thought that why I'm living in such a city which is so crowded with a lot of problems and pollutions and going around. But let's see, post-COVID, maybe things will change, and we'll see what we can do best for our family.
Well, that's the thing. I think everybody should do what is, and this is a conversation we had with one of our guests on Tuesday, and he's from LA as well, is just do what's best for your family at this point, right? You know your family's limitation, you know your family's health. And if you know that you're going out to a picnic area and there's not a lot of people there, then go out and enjoy it. Go out and enjoy the fresh air. There's just, I think there's a lot of ridiculousness in some of the things that the government has put down on us, maybe because they just felt like humans wouldn't know how to do things. So they just put all of these restrictions on us. There should be no restrictions to going outside. Just don't be near each other, right? Be respectful to other people's parameters just until we figure this out. And if you are sick, stay freaking home. What is wrong with people? People go to work sick anyway before this came around. I always fire people when they come to work sick, because if you come to work sick, that doesn't mean that you're dedicated to your job. That means you just don't give a hoot about anybody else but yourself. So I have big issues with people coming to work sick, especially with fever. And in this day and time, if you go to work sick, you shouldn't just be fired, you should be arrested. But just be common sense at this point. And the problem why the government is so concerned is a lot of people are not going to be informed enough. They're only going to hear half of what they need to do, and they're only going to do half of what they should do. Right? So majority
All
of
right, I gotta get ready for my dryoutube.com webinar. You guys are welcome to join. I'm on Facebook too. I found a way to stream it on multiple channels.
Well, do you want to play it while you want to just air it here? But I don't think we have another guest coming right now.
Yeah, I
We
can
have,
just put you guys on the screen and
Dr.
introduce you, and we'll just continue the conversation.
So why don't you go ahead and we'll sit back and let you do your webinar and
Yeah,
stream.
'cause you should show up on the screen. So let me.
Yeah, we can just enjoy the webinar and sit back, and I can eat my blueberries and
We can do that. So Dr. Tula, I think he missed it. He would be joining us earlier, but somehow maybe something happened. And Dr. Ahuja said that he would be joining, but someone from his family just turned COVID positive. So he was little, yeah. So that's where he messaged me right now. And Dr. Arthur is not available because he's busy with a lot of patients. So that is what's happening with.
well, a lot of things are going on.
All right, I'm gonna set it up. You guys go ahead and talk.
Okay, go ahead and set up what you have. We had another guest I thought maybe might join us today. He's one of the serial entrepreneurs like Dr. Yu and myself who kind of pivoted in the world to help do resources and supplies for PPE. And he was going to come on and just talk a little bit about what's going on in the world and industry. But he also does small houses, which is really cool. Like that's what his other job is he has big warehouses, and he builds small houses. And I think that's interesting because, a lot of people are going that route, buying a small house, cutting back their life and their lifestyles. And
yeah, I saw that. Yeah.
So I thought he would be interesting to speak with, especially considering the fact that, he was like, well, I got this big warehouse. Why not do other things with it during this time? Because I can't sell my small houses right now. One of the things I want to work with him is, did you remember that device I showed that does solar water generating and all of that? Ankit, you remember that device?
I remember
So I kind of want to introduce him to that device to see if it would, because I think it would be perfect for a small house or a small cabin, that you could be completely off grid and still have all of the electricity that you need to operate a place like that, for a minimal cost. Like for my house to go off grid, the electric company came in because we can't go through anybody else. We have to pay the electric company to do it for us, which I think is a monopoly. But it's $85,000 for them to install a solar system, and we can't go off grid. We resell back to them. So we resell back to them, but we're not going to get our money back. So anyway, $85,000.
I wonder if solar is going to come down. I've been kind of waiting. So
I've been working with this man who's just a brilliant brain in the solar industry, purely because he's a survivalist. And he actually got a patent on this. He patented a unique device that's very portable, but you can turn your home, a 3-bedroom home with 2 bathrooms, and run it off of this one device, one solar device. You don't need all of that technology that they come in and engineer and install into your home. You don't need all of that. He runs his 3-bedroom, 2-bathroom house, and what it does is it also pumps water. Right. So it does everything. It runs your electricity and it pumps the water you need for your house. And he went totally off grid, which is against the law in most states. It's against the law to go off grid. He built his whole business building. This is what was interesting to me. He started a water store, and he built the whole building with all the power tools ran off of this one device, which is a small, it's like a small suitcase. It's the size of a small suitcase. In fact, I got one and brought it back on the airplane with me.
Kim, I'll tell you, so I've invited one of my friends who is a solar and electric engineer. He will be joining us on Wednesday, and we'll talk about how we can generate electricity or with solar. And there are a lot of ways to do it. It's just that as stem cell, people are not supporting, and government is not supporting because if we do that, then the big electric companies, they might be having a tough time. So, that's why he's struggling, but he's doing a tremendous job. And he said that in desert, we can create a lot of electricity, and that happens around the time because in the daytime it's too hot, and in the night it's too cold. So this is the best way.
It's time to start my
All right, let's start our
Friday webinar. I just need to make sure I can see you guys. Here we go. And I'm actually streaming it on YouTube and my Facebook group page, which is Create Wellness, and our Facebook corporate page, which is called Laser STEM. So today we have a couple special guests. They're kind of my partners in Prime TV. So I'm a regular guest on IBM TV, and we talk about world issues, especially health issues, how to protect your health, how to manage your health through this COVID pandemic. We have world-renowned speakers, physicians from all over the world, and so I'm honored to be part of the show. Every Saturday morning at 9 a.m. Pacific time, I have a Super Stem Cell Saturday show where I talk about the latest research and treatment modalities in what we call regenerative medicine using umbilical cord-derived birth tissue, stem cells, umbilical cord-derived exosome therapies and research, clinical trials. And without further ado, what I'm going to do now is because everyone's sick of hearing about, staying inside, self-quarantining. We want to get out of the house now. I think everyone's ready to get out. Businesses are starting to open up, but again, we want to go out of the house safely. I don't think you have to be afraid when the media says, "Oh, there could be a second wave." All you can control is yourself, your immune system, and to keep it strong. Plenty of vitamin C, vitamin D3, sunlight to make vitamin D3 as well. Vitamin A, healthy vegetables and fruits to get your vitamins and minerals. Maintain a healthy microbiome. 80% of the immune system's in your gut, and if you don't have the good biotics, bacteria from a good broad spectrum probiotic, cultured foods, sauerkraut, pickled foods like organic pickles, even the juice, Korean kimchi has a lot of natural good probiotics. Yogurt, kefir, hopefully organic, farm grass-fed from raised animals. And then you want a broad spectrum spore-based probiotic, because most probiotics you buy at the supermarket, they're broken down in the stomach acid. You cannot absorb them, so you're wasting your money. So you want one that's spore-based. Spore is like a husk. It protects the probiotic, so it'll survive the gut acid and be absorbed. We happen to have the spore-based probiotics, and you can get them online, or you can get them at our clinics. If you go to drphilipu.com and press shop, we have like an online shopping cart with these health products. All right. What I wanted to talk about today as well is what measures our clinics are taking to keep our patients safe when you do visit. So here's what we're doing now. Let me just play that. Our clinic has been open, and I just want to show you all the precautions and safety measures we are taking in our clinics to make it safe for our patients and the public to come in through sanitation, proper screening and testing, and social distancing, and personal protective equipment such as the KN95 mask. Okay, so if you do happen to need our services and you need to come in, absolutely, this is exactly how we're making it safe and actually fun to come in. Without further ado, I'm going to play this video I took yesterday in our Palm Desert 21st Century General Medicine Clinic on the measures we're taking to make it fun and safe about coming in to see us. So here we go. Philip Yu at the Desert Laser Med Pain and Regenerative Medicine Institute, and we're just demonstrating how we are staying open and we're maintaining social distancing. The way we do that is Omar, he just texted the next patient while he's wiping the doors and handles down. And we have all our patients wait in their cars up front. That's the Bushmans, and they're coming in the clinic right here. Hey, how you guys doing? You got your mask? Did Omar text you to come in? They're pleased to come in. So go ahead and open the door.
Good evening, Dr. Ahuja, and good afternoon to Lynn. How are you doing?
I'm fine.
I'm doing great. Doing great. Dr. Jalen and Dr. Philip, how are you?
Yeah, I'm fine. How are you with you, man?
Doing great.
So hold on a second. I'll try to share the screen.
Everyone needs to wear a mask. And Melissa, you want to take?
So, Dr. Ahuja, what happened? You mentioned me. Someone is just in your family.
Yeah, actually, one of my relatives, they are in Delhi only, and they have turned out to be positive. And not only the guy who is positive, the entire family is positive. And even the house where I'm sitting right now, just back to me, one more house is there. All the 5 members have turned out to be positive. Similarly, after 4 or 5 houses from down the lane, again the 5 patients within the same house, they are getting positive. So I think the community transmission, or what we called the rapid surge in the cases, we can see right now in Delhi, because the number of in testing we have increasing these days. Now we have 34 labs, 17 from the government lab and the 17 from the private lab. But I think the more testing we are doing it, the more cases we are getting isolated these days.
Well, I'm so sorry to hear about your family. What are the steps that they're being told to take right now?
Actually, the government, what they did is they have placed a poster which showing that they all the family members, suppose there are 3 members are there, so all the 3 are positive, and they need to be quarantined or so isolated for another 17 days. And if they require something, any kind of help, any kind of the medication or any kind of help in the form of ration or something like that, food material, they have to be supplied by the government official only, but they don't have to step out of their home, and they need to be strict isolation as per government rules. Another thing which they mentioned about that is, pardon me, please. You want to say something?
The antibody test or the nasal swab test?
How did they test them?
Yeah, the testing is 2 types in these days in Delhi. One is through the home, they collect the samples, and second is the drive-through mechanism. I mean, the person who have symptoms, they will go through by car and to a designated place at a particular time, which is given in the message box, in the text box, and by going to the center, the sample will be collected while the patient is seated in the car only. It's being seated in the car only.
Yeah, but what sample are they taking from the nose?
I'm coming to that. So most of the samples in the labs are by 2 ways. One is by nasopharyngeal and third is by throat swab. So no blood testing is being done these days. As so far in India is concerned, we are doing either the nasopharyngeal swab or both throat swab also.
Wow.
Yeah, I think if you're going to do the PCR swab test, you have to do it both nasopharyngeal and the throat, because you're testing to see if you have a colony of the virus. And if you just test here, you might miss the colony here. Yeah.
Yeah.
But
So
then
that-
even if you test both here and here, you might miss a colony in your mouth. So I think they should do both nasal,
So most of the
mouth,
labs,
and the antibody test, just as a second measure. But that's what we need in the US. We need more broad testing where you can do the sample at home and they could pick the kit up, or we could send it to a lab like LabCorp and get tested. But that takes several days. So the blood prick test seems more practical because you could ship it to their home. They prick their finger. It's like a pregnancy test or cholesterol test. You send it back, or through an online telemedicine consultation with a healthcare provider, you can determine if they're positive for the antibodies or not. So yeah, I think there's a lot of ways to do it, but we want efficiency and we want speed. So,
I'm curious too. When were they tested? When did they actually do the test, and how long did it take to get the results back?
So actually, what happened is there is long queue is there. Whether you go into the private sector or you go to the public sector these days. So there is a waiting period of around 2 to 3 days, depending upon the lab to lab, and minimum at least 48 hours waiting period is there in most of the labs. And as Dr. Philip has already said, we need to check both the oropharynx, that is the throat part, as well as the nasopharynx through the nose part. So as far as
So did they have any cold or flu symptoms? Your relatives who tested positive?
Yeah, actually, so most of I have gone through testing of my 3 relatives today. So it's not today. The result have come today. Yesterday I did it for my testing. So what they have symptoms is out of 3, 2 have the symptoms. One daughter of 3 years and husband and wife. Husband is showing the symptoms of fever, cough, sore throat for the last 2 days, and the wife is totally asymptomatic. But as a dictum, patient who is coming in close contact of who is having the symptoms. So I have gone for the testing of all the 3 members, and they have turned out to be positive, all the 3.
So are they getting any standard treatment? What treatments are they getting, if at all?
Oh, that's what he's getting to. Yeah, that's what he's getting to.
Yeah. So as far as all the 2 husband and wife, they are young, around 30 years plus, and the kid is very small, around 3 years old. So in kid, only symptoms are like just fever. Kid is not coughing up. So for prophylactic point of view, or for superimposed bacterial infection, I have just prescribed in Jathryn or azithromycin. Nothing like any hydroxychloroquine or something like that new drug. So for that kid. But if you talk about the adult, yes, I have put him the man into the hydroxychloroquine as well as the azithromycin, because right now we have hydroxychloroquine in India. Remdesivir soon will be going to available in the Indian market, but right now we don't have it. And also remdesivir is we know that from the data it's been used in the severe cases. So the patient who is having very mild symptoms and those who are asymptomatic, so that we don't require them to give to the remdesivir.
So you're talking about antibiotics too. Erythromycin, you're talking about antibiotics too?
Antibiotics to prevent the superimposed bacterial infection in the throat, because we know that the most of the patients who are
we belong to the American Academy of Stem Cell Physicians. We're coming up with guidelines that we're going to send to the president, and hopefully he'll get it to the CDC. Hopefully he'll listen to us. So if you're tested positive and if you're asymptomatic or very mild, you just need high dose vitamin C, oral or infusion, ozone therapy, and vitamin D3, zinc, and something called monolaurin. It's on the wall of the viruses. If you're stage 2, which you have mild to moderate symptoms, cough, fever, sore throat, maybe some coughing, some mild cough symptoms. You probably need something called methylene blue, which it can kill the virus if you swab your nose, get it in your mouth with UV light. It's a mouthpiece that they use to whiten your teeth. But the UV light can activate the methylene blue. It'll kill the virus before it can get down deeper in your throat. And then stage 3 is severe cases. They have some fibrosis in their lungs, difficulty breathing, decreased oxygen saturation. They need something more aggressive. Ideally, umbilical cord stem cell therapy, which can immunomodulate the immune system. When you IV stem cells, 99% go to the lungs, which is perfect. Yeah, there's studies in China where they were using the umbilical cord blood. They've been reversing the COVID symptoms with totally in 2-3 days. So there are several labs doing that umbilical cord stem cell and natural killer cell therapy for COVID in the US. And then if the natural approaches don't work, then we could talk about erythromycin, hydroxychloroquine, maybe remdesivir for more severe. Of course, oxygen too. Hopefully hyperbaric or an oxygen mask for moderate to severe. But intubation, that's like last resort because it's hard to breathe. Only has a 20% survival rate. And then, and then the supposed vaccine, which, probably take 18 months, which is a moot point because the virus is already mutated. So why are you going to put a vaccine with no safety measures or testing on something that's probably not going to work on a mutated virus? So these are the conservative measures our academy is presenting. We're actually practicing in our patients. We just think there should be a national or even international standard. But the WHO, they don't talk about all these natural alternatives. They only talk about the hardcore drugs and
maybe
vaccines.
some of that is something we could collaborate with India, especially with Dr. Jatin, sharing a real life experience, right? Is that we can take some of this data, Dr. Yu, and institute it into some of the conversations you want to have, that the natural applications are working just as well. But I am curious, how have they asked the family, because you're such a tight-knit family in India, how are they reacting as a family? Certainly those 3 are kind of isolated, but what about the rest of the families? Are you guys being tested and things like that?
Yes, yeah, you are right. Actually, this is just a social distance or social isolation, not the emotional isolation. I know that the time is really very tough these days for entire India, and especially if you talk about the metro cities like Delhi and Mumbai, they are hardly hit by this virus. And what we do it, what we do it, that apart from the prophylactic antibiotic, I have also given him, as per Dr. Philip, vitamin C. I asked them to take a lot of gooseberry. I asked them to take a lemon water. And the third, just to boost up your immunity. And the third, a lot of hydration. And third thing, which I asked them to take a zinc supplement, because we have zinc supplement. As we know that most of the studies from the previous viruses, like from influenza, polio virus, that zinc has the antiviral property. It's a general antiviral property. It inhibits the replication of the viruses. So as a short duration, 5-10 days hardly matters for giving the, even I have this strip of zinc. Yeah, so I used to take it. I used to take it occasionally, just to supplement or immune my body, make my immune body to the virus. But
40,
we never know.
40 milligrams a day, right? About 40.
Pardon?
How many milligrams a day are those tablets?
Yeah, I used to take around 50 milligram per day.
Yeah,
but
40,
studies which is being done
it interferes with the RNA transcription of the virus. They can't replicate. Breaks down the wall. Yeah.
Should we also use zinc tablets then?
Pardon, Ankit?
Should we also use zinc tablets to boost immunity?
Yeah, zinc is not as a immunity booster, but definitely it has the antiviral property. Suppose you don't know, I'm a healthcare worker, I'm going to the daily hospital.
Okay.
I never know that I'm getting contact with the patient. I may not throwing the symptoms right now,
Yeah.
but who knows that I may be asymptomatic carrier. Who knows
Exactly.
that virus is in my body?
I'm concerned about my father because he used to go to dialysis twice a week, and you know that he visits Max Saket. So I'm just concerned that can he take those zinc medicines?
Yeah, there's no harm in taking zinc as an alternate day. I used to take it on alternate day basis only. 50 milligram, very minimum requirement. For though studies which has been done in the initial part from Wuhan, it suggests that 50 milligram you have to take 4 times a day. That is total 200 milligrams for the better action antiviral property. But that is to be given only in proven cases. I am not a proven case right now. So
Yeah.
I don't want that I should take it 200 milligram on daily basis. And how long I keep on taking it? So what I do to myself is I used to take it on alternate day or twice weekly, just to make it could be might have a placebo effect also. I don't know the exact.
No, you could just take the vitamin C zinc lozenges.
Sure.
I think Ricola has that, right, with the honey, and just suck on that every day as a prevention.
Absolutely.
And if you happen to get virus or bacteria in your mouth or throat, that might kill it before it goes down to your lungs. So, yeah.
Yeah, the zinc and vitamin C, all of that, those just good, healthy alternatives. The thing is right now is that now you're having to address family has it, who have they been around, who's asymmetric, who isn't, and I guess everyone needs to start getting tested. How long do they suspect that the family members have had this? How long do they suspect?
So things are like that. Patients who are getting these symptoms, suppose I am in 3-4 families in my contact, those who are throwing the symptoms of fever or mild sore throat, most of the patients, if I ask them, is there any positive history of coming in contact with a positive person, none of them having the history like that. But definitely yes, they have the history of coming in contact with one of their close friends, or somebody is visiting their home, somebody is providing the vegetables, fruits at their doorstep. So things are like that. So whenever in Delhi symptoms, the disease is so severe these days, those who are throwing the symptoms on a upfront, we are going for a testing. And not only the testing part, we are also boosting them that you don't have to worry. 80% of the patient, the virus doesn't cause any symptoms, but any not symptoms, any complication. You got the fever, got the sore throat, take care of your immunity, the virus will be gone. That's the thing I think the most important part. Rest 20% of the population, you may require hospitalization, you may require a ventilator support, but that is negligible, less than 2%, and that too depends on the age factor, your prior comorbidity, your prior asthmatic condition. So these are the conditions which are posing the real threat to the COVID-19. But I think the young population, those who are less than 40, without any hypertension, without any coronary artery disease.
Yeah, let them go out and work and be functional.
Yeah.
No, and I think that there's a balance, and then there's checks and balances we need to be doing just to stay ahead of it, right? Just like we do if you have pain, stay ahead of the pain. So we know a lot more about this than what we did 3 months ago, and I think that just by doing the common everyday practices and boosting up our immunities, but staying ahead of it, testing. I think we still need to test just for screening purposes only, just like we do screening for HIV, right? We've never found a cure for HIV. We have never found a cure for Ebola. But when we know something doesn't seem right, we start screening. You screen to do what? To early detect and isolate and treat. Those early we do the same thing for cancers, right? We screen for cancers. And we do that for what? Early detection. So that we can treat maybe.
That being said, we were talking about the infrared cameras, right? They're on drones, and they could see if you have heat. You know,
Yeah.
like the movie Predator, where he has an infrared camera in his eyes, and he could see if he has that health. Well, that's how they do mammograms. It's an infrared camera, and if you have inflammation there, you're at risk for cancer. So we could easily install these infrared cameras to see if you do have a fever. We can also use a non-contact infrared laser thermometer, and it's just a screen. I mean, you could have a fever because you ran, or you have another infection, but there are some conservative measures we could take to keep the public safe.
Well, I know that
Yeah.
in those infrared screenings, they also know that you can have spots, right? And hot spots or spots that could be other things going on, and then you should address those. And I shared with the crew here earlier today what they call early detection screening system that does that. It scans actually just the breast areas for abnormalities. It's not about detection as much as it's early screening to go see your doctor if something is abnormal. But you can, instead of the old-fashioned way where you can try to feel for it, which is very, very hard to do, it just screens you every day. You just take the screen, and artificial intelligence tells you if something has appeared abnormal that doesn't need to be there. And it's all infrared heat sensor screening. They're still working on it, but these are technologies, like you said, like the drones that can scan the crowds. We have
Why can't we enable those cameras on our doorbell? Maybe on Ring, what you use outside your door. I mean, so whenever you come out, scan you, and then you can share the data with the doctor.
Yeah, we have on our iPhone, you can plug in the infrared thermography camera, and it'll scan your body to see what parts of your body have inflammation. Like, we do it to see where you have pain. So if you have a signature on your knee that's really yellow, which means really hot, like the sun is really hot, it gets yellow, then we know you have inflammation there, and that's where we treat you. That's where we put the stem cells. The stem cells are like firemen. They're going to go where the heat is, the inflammation. So yeah, there is a lot of technology that you can just put on your iPhone, and then we want to make it where we can monitor the patient from home, because we're doing a lot of telemedicine consults. We want to make sure we have some type of system to monitor their health at home. How much inflammation do they have in their body? So we could tell them the treatments virtually. This is where medicine is going, because people are afraid to go out and get infection going to the clinic or hospital here. And I've been doing a lot of telemedicine video calls, and a lot of patients like it because they could do it from their home, or they go to the clinic, they sit in front of a computer screen. I can consult them from my home, so I can stay less stressed. I could service more patients without having to drive to all these clinics. So actually, I think that's where medicine is going. We can monitor your health from home. Let's send your test kit at home, prick your finger. If you have IgM, you've had a recent COVID infection. You're shedding the virus. You're infectious. You should quarantine. You have IgG. That means you've had the infection for more than a few weeks. You don't have symptoms. That means you've developed immunity antibodies. You're probably safe to go out and work. But make sure you're taking your supplements to stay healthy. So yeah. Anyways, I gotta go finish out my podcast. We'll see you guys tomorrow at 9 a.m. at Super Stem Cell Saturday. All right.
That's right. STEM Super Saturday. Stem Cell Super Saturday. Thank you. Bye, Dr. Yu.
Thank you.
Say that 3 times. Wow. So I'm very sorry for your family's experience, and thank you for sharing with us. That's got to be very scary.
Yeah. Thank you for the concern. And now I think the level of transmission has gone to the different stage in India so far, and that is not into the entire India, but I'll say to the certain cities of the India. I think today the government also has declared there are certain cities, like 13 cities in India, and those are the cities where we have more than 70 to 80% of the infection, which we are looking into it. And rest of the states or the cities in India, they have very low transmission, even negligible. we are hardly seeing any cases. But if you talk about the hotspot areas like Delhi or Mumbai or in the Maharashtra, different cities are there. Definitely, we are having the very high number of cases. Last night, we have more than 1,000 cases being recorded within a Delhi within the last 24 hours. So I think starting from less than 50 cases per day to more than 1,000 cases per day, Delhi is creeping. Larry graph is creeping very slowly to a another level.
So, do you think though that a lot of the increase is just purely because we've increased our testing? So, of course, we're going to know that there's more infections out there because we're able to test more. Perhaps maybe that all of these infections, if not more, exist out there, but our numbers are going to change and increase until we're able to test everyone, right?
Yeah. There are multiple reasons for that. One thing is definitely yes, we have increased the number of testing. Second reason is that just after the third lockdown, there's a little bit of eased up of lockdown is there. There's a lot of permission which has been granted by the government. So a lot of traffic again has been resumed onto the roads. So there are a lot of public these days onto the roads, and since many of them are using masks, few of them are not using masks, and also it's very difficult to make everyone understand the importance of mask, make importance of the hand sanitizer. Yes, people started recognizing it, acknowledging them, but still it's very difficult to the city of 2 crore population, more than 2 crore population in Delhi, a small city. So it's very difficult to cut through to contain the virus. It's very difficult. Now initially India has also started the aviation also, but now I think they have again put a little bit of pause also. Only very limited flights are going though these days. So these are the things. Already WHO has warned many countries that easing up early could be dangerous, and still we are very very far for the development of herd immunity or development of vaccine in the near future. We don't think so that within 2 months we'll be having the herd immunity. We'll be having the vaccine in our hand. So there are a lot of concepts these days are going that we have to stay with this virus. Definitely, we have to stay with this virus. We don't know how long we have to stay with this virus, but we have to change our practices. How we have to get out of our house? Do you have to change our mask on daily basis? Do we have to clean our hands on every frequent object we are going to touch? So these are the things which doesn't come within a day or week or month. It takes time. So still I think India is struggling hard to inculcate those practices.
Those aren't easy practices for our way of living in this day and time. For some cultures, the disciplines are not as difficult. In the U.S., we struggle with those disciplines, and our numbers show proof of the fact that we lack that discipline or ability to do that discipline. The fact that we slightly opened and gave the orders of no more than 10 people at an event, and over the weekend, one of our places held an event with 4,000 people crammed together, is an indication of how our country is not respecting the disease and the impact that it's going to make on our lives. It's very disappointing. I'm not going to, politically get involved in the arguments over this because people feel like they have a right. And my thing is okay, if you corral all those 4,000 people together and they get sick, do you treat them? Do we have to treat them? Should we liably, if people are being irresponsible? Whereas you've got people who are trying to be responsible, maybe didn't go to that event, but has to go to the grocery store, and they're taking all the precautions they can. And one of those people come into that grocery store, and then they get that person infected. So I mean, people are just not being conscious about the mass impact because it hasn't affected them. I think, go ahead, Ankit.
Dr. Jatin, I have one question that everyone is saying that young people like me can go out and work and then we can come back. And we have that immunity and in very few cases, someone can caught COVID positive and then they have to undergo the diagnosis or treatment. But suppose if I'm going out and I am coming back and my family is living with me, and I'm not having that infection, but I can still spread infection to my family, and I'm safe from COVID. I might be test negative, but they test positive, and that's what's happening in India. That is what I mean. I'm talking to a lot of people. The person who is going out, he's fine, but the person who is living in the house, they are having the COVID positive cases. So, what are your thoughts on that?
This can be happen to anyone, either you or me, those who are getting out of the houses. And and we never know that whether which category. I think we have already discussed earlier also that which category we are going to fall, whether it would be asymptomatic, very mild, moderate, or a severe one. And we never know also. We could be a asymptomatic carrier as well as spreader also. We can be threat to our own family also. So what happened is that, provided if since you talking about me, that around 1.5 weeks back, last Monday, one of the healthcare worker has symptom of fever, cough, sore throat, and she was adamant that, hey doc, if you are going to examine my throat, then only I will show you my that consult with you. Otherwise, I'm not gonna come to you and have my consultation. So are you willing to check my throat? It's really paining, and I need to check it whether it's any foreign body or any kind of ulcer in my throat. So it's very difficult to check anyone's throat these days, and that too is a very close focus. So, but since I have PPs, my N95 mask, my face shield, I examined her. I asked her, the moment I asked her to just open your mouth and say I have a torch in my hand, one hand, and I have one spatula in my one hand. The moment I say her, just open your mouth, she started coughing up. The mask was here, and she started coughing up. You can imagine my state. I asked her, ma'am, please do. And this is not.
Oh my gosh.
And this is not enough. This is not enough. Things gone wrong. I examined her in the morning around 1 p.m. in the morning. Late in the evening around 9 p.m. I got the call from my medical officer. Hey, Doc Jatin, do you know that you examined one female nursing staff in the morning? Yeah, I know. I remember that girl. So she has turned out to be positive.
Oh
my God.
Oh no.
My brain suddenly stopped working. So I don't know what to do now.
Start thinking, what did I do wrong?
Did you undergo the testing?
No. So what happened is I quarantined myself for the 10 days. So I didn't step out my house, but I did it to myself for my my family members, because I have 2 small kids. So I used this N95 mask. And I have one sterlium also. This I always keep with me. These 2 things.
Okay.
So whenever my kids, come close to me, so I always scrub my hand and use this N95 mask, so that I don't get, transmit my virus to them. Because maybe, I may be asymptomatic. So this thing I continued till now also, because still now I'm asymptomatic. I may be asymptomatic carrier also. I may be, but being a healthcare worker, and we keep on coming across these kind of patients on daily basis. So what should be my initial point? Government says you have to, those who are asymptomatic healthcare worker coming in a contact with a positive person, they have to go for testing in between day 5 to day 10 of the exposure. But my exposure is on daily basis. So should I go for keep on testing on daily basis? It's impossible. It's impossible.
No, we can't, and you can't determine how it's.
Dr. Ahuja, when was your last testing you did it?
No, so what I did is I didn't go for my testing so far, but what I followed is I've used full PPE kind of gown, and when I examine these kind of patient, I have my gloves, I wash my hands regularly, I have a full sheet, and underneath the full sheet I have N95 mask, and above the N95 mask I used to wear the 3M ply mask also. So there are three
All right.
protection I used to take it. So yeah, so level of exposure was my minimal, but somebody is coughing directly on your face.
Oh no.
So
Oh my gosh. But here's what I gather from you, and because you are an infectious disease doctor, the important elements of all of this isn't just so much about protecting yourself from getting the disease as much as, if you think you have it, to wear the mask to protect others. The wearing of the mask is more about protecting others. And God bless you for having to be around a woman who's coughing and sneezing and spreading, and you're still there serving them. There's nothing we can do to prevent those incidents from happening, but you've said you did all the precautions necessary, and it sounds like it worked, right? It sounds like all of your cautions, the shields, it sounds like it worked.
Yeah.
Thank
So
goodness.
what happened? Yeah, so what happened is these exposures are what we are going through on daily basis. And being a healthcare worker, being an infectious disease specialist, we cannot say that okay, now we don't want to work in the battlefield. We need to work in the battlefield. If not we, then who else will going to do this thing? Who else will going to do this thing? Somebody has to fight in this battle. And yes, there is a risk. There is a risk to our family also. But this is not what we are battling in this field alone. There are certain police personnel who are also battling in this COVID pandemic. There are certain other paramedical healthcare staff members. There are a lot of janitors, those who are working in the hospitals premises. So many persons are there, those who are battling in this COVID-19 pandemic, and all are under threat on daily basis. The moment we get up in the morning, we open the TV, we listen to hear about that. Oh, this is one of the famous doctor. We have lost this doctor. Similar with the states also. The moment we open the Twitter account and we come to know that one of our Infectious Disease Society of America, one of the famous ID docs, one of the famous nephrologists, one of the famous internal medicine doctor have lost their life. So it's in all over the world, healthcare workers are at risk. And the good part is this, that now we have certain amount of improvement with the remdesivir. The remdesivir could be a Ramband, which we call holy thing for our. It could work in our scenario also, as which we are getting data from the states also, from China also, from European countries also, that remdesivir could be of help. And now India has started this manufacturing of remdesivir with the help of collaboration with the Gilead Pharma. Two companies of India, Cipla and the Hitro, they have started developing it, and soon we will have this drug in our Indian market, so that patients who are developing very severe disease, they could be survived.
Well, and I think that we're going to find as we move forward that a lot of the answers are going to be just as simple as other medications that we've been treating with, like Dr. David Moskowitz has discovered that he's treated his patients with just asthma medications and adding a supplement of quercetin, which I started taking quercetin just to see if it will help me increase my energy. So I think as we move forward, because all of these medications, just some of the ones that you discussed earlier, they're about treating infections. They're about treating, inflammatory. They're about treating all of the things that actually happen as a symptom from the disease or virus. And we learned today it's a disease and a virus, right? There's two things. You can have the virus and you can have the disease. And that was very eye-opening to me today. So I think that
let me clear you.
Go ahead.
Sorry. Let me clear you two concepts over here. You might be heard about the name of tuberculosis, though it's very rare in United States. It's quite common in Indian scenario, in developing country. So what happened is, the moment the child born in the the newborn get delivered in the Indian setting or in a developing setting, within a 1 month or 2 months, he may get exposed to the tuberculosis bacteria. But happened what is, it gets, bacteria gets into the lungs, and it gets, engulfed by the macrophages. It resides in the lymph node. This is what known as, uh, infection. This doesn't mean that tuberculosis in my lung that I have the disease. It is just a latent infection, what we call as the latent infection. But the moment my immunity goes down, the bacteria gets aggravated, and it leads to development of the TB, tuberculosis disease. So what we are looking into the patient, we are looking into the tuberculosis disease patient, not the TB infection patient. Same with the this kind of virus, though virus potency is not known. There is no term like latent viral infection in with the COVID-19. But there is a term known as asymptomatic COVID-19. Virus getting into my body, getting in the all the circulation throughout my body, but it's not causing harm. It is not causing any kind of my organ damage. So this is asymptomatic COVID-19 infection, and but they are the one who are very risky to the other person, because suppose if I don't have symptom, so I may be a transmitter. I can transmit to Ankit. I can transmit to anyone. Because if I don't use mask, so mask is mandatory, irrespective of Ankit symptoms or mine symptom. Irrespective, you can't ignore the mask. You can't ignore the hand hygiene part.
Yeah.
So it is, it's a new thing for the our generation, or maybe the upcoming generation in the near future, that masks are mandatory. We need to consider that this, it's our one of our, privacy part. We need to hide this privacy part.
I agree with you, and I hate that we're probably going to have to wrap up here in a minute. Can you come back tomorrow and finish this more of this conversation about what's going on with your family and everything? Because I hate that we have to wrap up.
Sure, I let you know, Ankit. Yeah, sure.
Because I think this is very, very, the information, first off, I very much appreciate your time. The information that you're sharing with us is so important, so very important for the world to hear about. And I greatly appreciate it. And I also want to talk about how we're going to be moving forward to start traveling, because I know that that's part of what you do in your business, is how we need to start being smart about traveling. A mask is very important, people. I'm going to buy 2 or 3, good masks that I can always wear everywhere. But a mask is going to be part of our life, and we're going to have to just keep finding other ways. So, but unfortunately, we're going to have to leave and depart at this moment. Conversations are awesome today, Medical Friday. Fortunately, we've learned some new things today. In particular, the difference between the virus and the disease, but also how we can fight it, right? How even when family has it, how we can fight it.
And before we wrap up, I'll just conclude what happened then. We started the Dr. Sareen discussing about liver, and now we can have, or maybe how we can maintain our liver in a much more healthier way. Then Dr. Sabu joined us in discussing about the fatty acids in liver and things like that. And then Dr. Rajendra Subbu discussed about the breast cancer and how women can take care of the cancer thing. And then we have Dr. Gupta discussing about the pain management and why humans are dealing with different kinds of pain and what are the ways to protect that. And then we have Dr. Yu discussing about the best ways to do the medication in future and how stem cell could be a great, revolution maybe in future. And then Dr. Ahuja shared as the best practices in the current situation of COVID-19 and what's happening with the patients, and how asymmetric patients also spreading a lot of threats to the people who are getting that viruses. And so I think it was a good show today. And thank you, Dr. Jatin, for joining us and sharing the information.
Thank you very much. Thank you, ma'am. Thank you very much.
And we would like to
Lynn Shepherd, who is our sponsor. Folks, don't forget to make your life easier, safer, and more cost-effective. Shop the dollar store for all of your dollar store needs. Soaps. We have soaps. They have surgical masks there that are very, very cost-effective, that are very important, like we were talking about today. It's more about protecting your family from what you might be carrying versus you. Plenty of masks are available. Toilet paper. anything you need. And of course, my favorite, but go to IBM.TV, hit that green button. It's a win-win-win because when you buy from them, they sponsor back to us 50% for our financial literacy programs. But again, you're saving money, you're saving time. Time is money. You're saving gas, and you're saving yourselves from being around potentially sick people. Thank you very much.
Thank you very much. Thank you.
Thank you.
Good night.
Thank you. And thank you for joining us today. It was Med Friday on IBM TV. Tomorrow we have different shows lining up on Saturday, and Sunday is a Super Sunday with a lot of music around. So thank you, Kim. Thank you for joining, and it was a great show. And would love to wrap up now with a social ambassador.
कोरोना वायरस से कैसे बचेंगे? हैंड धोकर और ऐसे अपने खांसी जब आएगी तो ऐसे करेंगे अथू अथू और कोरोना वायरस को धन्यवाद हमारा म्यूजिक सुनने का.
And thank you for joining us on IBM TV. We'll see you tomorrow. Thank you. Take care. Bye-bye.